All right, ladies and gentlemen, thank you. If you would rise for the Pledge of Allegiance, please. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, good afternoon, and on behalf of Commissioner Candelaria, Commissioner Ertel, and Shack, we welcome you here to our meeting here towards the end of May. And Commissioners, the first thing on the agenda is the minutes. Have you had the opportunity to look at the minutes?
Yes, sir, and I would move that we accept the proceedings of the Board of County Commissioner in Montezuma County, May 19th, 2020.
Second.
There's been a motion, a second, to approve the minutes for Montezuma County Board of Commissioners for May 19th. All those in favor?
Aye.
Aye. Motion carries. Second thing on the agenda, we have the public health. We have Bobby Locke and Laura Schaefer that's going to have some updates along with Southwest Health Systems. So.
Be sure and turn that on, Bobby. Thanks.
Okay. Think I'm on, right? It is green.
I can hear.
Okay. Okay. Good afternoon, everyone. Today I brought with me some guests who are going to speak to the impact that COVID-19 has had on their organizations and ways that we can work together to decrease the spread of the disease. First, I want to say, though, a little bit about how COVID-19 has impacted public health. So for 60 plus years, Montezuma County Public Health has been working under the auspices of helping our community with disease spread, all types of communicable disease, prevention and education. Public health has a statutory obligation to inspect restaurants and child care facilities, and we will continue to uphold that obligation. During the pandemic, we have been tasked with enforcing public health orders on every single business, gyms, hardware stores, recreation centers, pools, churches, camps, graduation ceremonies, events at the county fairgrounds, golf courses, sporting events such as Little League, and any other large gatherings of any kind, just to name a few. These tasks have become a consequence of the event and are beyond our capacity in local public health. What we can do, and we do quite well, is education and prevention to decrease the spread. One constant in this ever-changing trajectory of new orders from the governor as well as CDPHE will be physical distancing, sanitizing, and facial coverings. These three things will not be changing in our near future until a vaccine is developed. Our plan is to continue to help organizations, businesses, and individuals navigate these very difficult times that we are all in, along with promoting and encouraging compliance using a three-pronged approach: physical distancing, sanitizing, and facial coverings. So let me introduce our guest speakers. So first one that is going to follow me is Joyce Humiston. She is President and CEO of C&G Healthcare. Then we have Tony Suddeth, who is the CEO of Southwest Health Systems, Karen Labonte, Chief Nursing Officer at Southwest Health Systems, and Dr. Kent Aiken, Hospitalist Program Medical Director and Montezuma County Public Health Medical Director.
All right, thank you, Bobby.
So, Commissioners, thank you for giving me some time. And I brought you each something made by the hands of Karen Gray, our Dietary Director at Vista Grand.
Oh my God. That's a beauty. That's a beauty. Got a mask up cookie.
Very nice.
Tell her thank you.
She is talented.
So Karen Gray is very talented, and they're very delicious, and they're fresh. So while they're pretty, eat them, right? Because she didn't make them for us to look at. Okay, well, I wanted to come here today to tell you what's going on at the nursing homes and assisted living centers. You all know at the beginning of this, I wish everyone had paid more attention to what happened in Washington State at that nursing home, because it spoke volumes about what was going to be coming down the road at us. And then, of course, we watched what happened in New York City with Governor Cuomo putting COVID patients in nursing homes. And that was the order. I watched it. And I was shocked. I will say I was shocked when that was going to happen. And I knew the outcome. I knew it wasn't going to be good. But I'm here to talk to the three of you today. And, you know, I'm hoping the Colorado Department of Public Health and Environment is watching. I'm sure they are. And I hope a lot of people in the community are watching. So I'm here today to talk about the elderly, the disabled, and the immunocompromised in our community, and really across the state of Colorado and the United States. Because they're worth a lot. They're worth a lot to all of us. You know, I have bullet points here. I didn't bring anything to read. You know, I'm watching the posts on Facebook and social media, and I understand the frustration out here. I really do. I have people, I have a family member with a small business that's just suffering beyond words. But it does dismay me when I see posts on Facebook and social media from people saying that the elderly and the disabled and the immunocompromised can just stay home if they're scared. They can just stay home. They can't all just stay home. They can't. They don't all have families, and they cannot just stay home for the next 6 months. They have to be able to get out also. So it disheartens me when I hear things like that. You know, if I sometimes I'm thinking, you know, if the nursing homes and assisted living centers had been prioritized to begin with, like the hospitals were, we may not be in such a dire situation with the deaths across the United States. And I love the hospitals, and I love our hospital. But when this first began, you know, the hospitals and the staff at the hospitals were cheered as heroes. We were not. Our little nursing home sat out here in the assisted living centers quietly, and our staff was not hailed as heroes. And they just came to work every day, and they did their job. And I actually asked on a county meeting that the staff come and support our nursing homes, and they did. They came out in force, and I appreciate that very much. Our staff needed to feel important. They were also going home to their families, and you know, the risk is there. You know, it's interesting, PPE, so PPE is the word now, right? That should be the word of 2020, PPE. I don't even know if it's a word. It became contraband for us in nursing homes almost. I kid you not. I felt like I was smuggling. I was reaching out to the weirdest sources for PPE. I've never thought I would be calling a distillery in Texas to get hand sanitizer that smelled like tequila. And it was bad tequila. It wasn't a good tequila. And the residents were gagging as we were spraying it on their hands, our hands. The whole building smelled like tequila. And of course, I did warn people, don't drink it. It will kill you. It's 80%. I brought today these 5 books sitting up there, and I'm really hoping in many ways that the Colorado Department of Public Health and Environment can see these books. These huge binders. So these binders represent every regulation, every requirement, every suggestion, every threat of a fine to us since March 1st. That's what those books represent, and it's only May. So we're up to number 69, I believe, in the regulations that come out to us. So nursing homes were required to do, I don't know, like 4 weeks ago, an isolation plan. All of a sudden they decided to focus on us. And we had 8 days to do it, and it turned into an 80-page document. And if we didn't have it done in 4 days, 4 or 5 days, once we really got started on it, it was a $1,000 fine or a year in the county jail. Seriously, that was the threat to us. And me, so then I really went blonde or white, decided I wasn't going to look good in orange. And off to work we went, doing a lot of paperwork. I also bring these, though, to symbolize something else. I have watched the county commissioner meetings, and I've watched everything. And I want you guys to know that I understand the frustration, but I have to give a huge thanks to Bobby Locke and Southwest Memorial Hospital, because that represents what they've been going through too. So as the public and the community out here is saying, well, every week, and I see this on Facebook, right? Every week people change their minds. Every week the rules change. This is why. This is why the rules are changing. It's not their fault. It's not their fault. It's not our fault. We are being mandated. And if we don't follow these mandates, we'll lose our license to practice. And I feel so bad for Bobby and our local health department, because I know they're having to read all this. I know what they're going through, because this is what we're going through. And the hospital is also have an equal set, I'm sure, that looks just like that. We need to open this community, and we need to open it, I think, now. However, we need to do it safely. You know, again, I'm going to go now to the face mask. I hear everyone saying we have rights. We don't have to wear face masks. We have rights. Yes, we do. We also have responsibilities. As human beings, we have responsibilities. We have rights and responsibilities. I want the community to know when we admit a person to the nursing home, we give them their resident rights. And then we also give them this list of responsibilities. And one of them is to be a good human being. Has nothing to do with rights. It shouldn't be an argument about rights. I think if anyone goes into someone's business, they should have a face mask on. There are some people who really cannot do face masks. Immunocompromised sometimes cannot do a face mask. The disabled sometimes cannot. People with dementia. I want the county commissioners to know that one of the mandates on us now is that we have to keep face masks on our residents. Will you explain that to someone with Alzheimer's disease? Why they have to have face masks on, and why they have to be 6 feet apart. And our staff is up there running around like crazy trying to make this happen. And there's people like me out in the community. I'm so fortunate. I go home every night. But when I walk into Walmart, I have a face mask on. And I do it out of respect. I've been tested 3 times now, and I'm negative because I'm in and out of these nursing homes. But I do it out of respect for my fellow neighbor, for my community. I do it out of respect. And I just want to say to the people listening on YouTube right now, you know, if our residents can do this, and our nursing staff all day long in these masks, I've read the things on Facebook about, the mask is the oxygenation levels, and, you know, you can read everything you want to read. You can also read the site over here about how these could protect you. I don't know if they will or not, but are we really willing to risk that chance? Are we ready to do that? It's just not that big of a deal. It really isn't that big of a deal. And I ask my commissioners to support the use of masks. It shouldn't be that hard if I have a 95-year-old with a mask on. It just shouldn't.
Joyce, are the residents, when they're alone in their rooms, required to wear the face mask as well?
They are not. They are not, Commissioner Sukla. And now the state might tell you differently on that, but no, they're not. We are supposed to knock on the door before we go into a resident's room, and we've actually been cited by the Department of Health, not our Department of Health, the state, because we had a surveyor in, and one little nurse aide forgot to tell the resident to cover her face, and it was a confused resident. She wouldn't have understood anyways. But no, they're not, and nor should they be. You know, we shut our nursing homes down. We have 7 nursing homes in the state of Colorado. So I go from Cortez to Trinidad down Highway 160. And I flipped 10,000 miles on a new vehicle doing this, taking my contraband, as I call it, the PPE up and down the highway. I actually made sure my nursing badge was always there because I thought if I get in a wreck, someone's going to think I'm black marketing it, right? Well, it was a little airy out there on that road. But we shut down the 1st of March. Our residents are isolated in their room. We bring them out one at a time, and we take them outside for walks. You can go up and see that. And the same thing in Mancus. So while we're asking people to wear face masks, and I watched the argument about it, I want the people in the community to know, and the people up at the Colorado Department of Public Health and Environment, I have watched families drop to their knees outside the windows of these nursing homes in tears. I have watched them hold on to a window, just trying to talk to their mom, their dad. We've let families come in, of course, in what the state calls, special circumstances, meaning someone's passing away generally. And we temp them, we mask them, we gown them up now. And then I'm sorry for those out there who just absolutely protest this. I've watched worse. This is not that difficult. I'm going to say it again, this is not that difficult to do. And I think every small business, by the way, should be opened up, but I think with some rules in place. Honestly, the small businesses can do things better than I think Walmart's really tried. I really think they've tried hard. But it's hard. It's like Ace Hardware and everybody else. But I think the small businesses can do it better. They can be better about it. So while we need to open this community, I'm asking that we do it safely. We've recently, and it's probably just as well I'm doing this up here on a YouTube. We recently had an employee test positive at Vista Grande Inn. And it was interesting because I felt like all of a sudden there was a bunch of shame about this because this employee tested positive. There was no shame in it. She tested positive. We immediately shut down and we tested every resident in that building, thanks to Southwest Memorial Hospital. And they came over with their guys in the full gear, and they helped us. And we got every resident tested, and I'm pleased to announce every resident tested negative. But we also tested every employee at that point. We had 4 more come up positive. They were active carriers. 4 of the 5 had no symptoms, whatever. I mean, none. We would have never known. They were younger people. And that's my concern out there, and I think that's my education to the community I want to talk about for just a second. We have people walking around with no symptoms, but they're carriers of this virus. That's why they need to wear a face mask. It is spread by droplet. 1 sneeze is all it's going to take on the green beans in Walmart. It's really that simple. And someone else touching it, and then touching their face. The reason it spread so badly in New York City, and I've told all of my staff this in 7 buildings, and I believe most of them are watching right now. People in New York got on the elevators, and they all pushed the elevator button, didn't they? Well, somebody had COVID on their hands, because they sneezed, probably, and they have COVID on their hands. And they got on the elevator, and then they pushed the button to go to their apartment. Well, they live on top of each other there. And then the next person got in the elevator, and somebody did this. They touched their face, and that's how it spreads. If nothing else, the mask keeps you from touching your face, because I'm a face toucher. I am. So I am happy to announce those 5 employees are healthy. They're at home quarantining. And we have now tested every resident again at the Vista Grande Inn Nursing Home this morning. There are 95-year-old people up there getting tested, folks. And we are doing everything in our power to keep it out of these nursing homes and assisted living centers. But we need the community to help us. And we do sit on the backside of that hospital quietly. And we don't brag, we don't make a lot of noise. But these are our grandparents. These are our aunts and uncles. These are our neighbors. My father, I promised him I would say this. My father read I don't know, some article in the Free Press or there was something. And there was a comment made about how the elderly need to just die if they're going to die, that they have problems anyways. Well, you know what? We're all going to be older, aren't we? We're all going to be there one of these days, and I don't think that's the answer. And I think if this mask would protect just one, I ask the community to really think about this a little bit more before everyone just keeps saying we have rights and we don't have to. You also have responsibilities. Our staff is now going to be tested according to the state of Colorado, which I applaud, by the way. I've asked for 100% testing. I've actually begged for 100% testing in all of our nursing homes in Trinidad, Durango, Mancos, Cortez, since this all began. We don't know what we've got. The problem is, we don't know how to deal with this because we don't know who has what. So we walk around and we're watching symptoms, and then I have 4 people who have no symptoms, and I'm going, well, how does that make sense? You know, what are we supposed to do with this? So we are now, all nursing homes in the state, and I believe assisted living centers, are now all employees are going to be tested every week for 8 weeks. And I don't know if the commissioners have had that Q-tip up your nose yet, and I don't wish it on you, but I have 3 times, and my nose has bled twice. And I will do it again, and I'll do it again, and I'll do it again, if that's what it's going to take to keep my elderly people, your family members, I've probably taken care of every one of your family members, safe. And the people out in the community, I've taken care of your family members. And I'm going to keep them safe. So I'm going to close in a second, I promise. I just thought, I grew up with all of you. Well, you're older than me.
Not all of us.
I don't know, Larry Don, we're going to look at this. I just wanted to come here today to talk to you from my heart. You know, I'm just as bad as some of the other locals. If you haven't lived here 3 generations, you're never going to be local, right? And I'm 4th generation, so I'm a real local. I wanted to come and share my story with you, and I wanted the community to know what's going on in these nursing homes. I don't want to be that nursing home in New York that gets 20 COVID patients positive and half of them pass away. What are we going to do? And I'm fighting to keep this out of these nursing homes. Let's open the businesses, commissioners. I'm tired of seeing these small businesses. It's breaking my heart to see these people. They're going broke. They're literally going broke. And they work their entire life for their businesses. They don't deserve this. But it needs to be done with some rules. And I don't think rules are that hard to follow right now. We shut down long enough, right? So what is a face mask and a little hand sanitizer going to hurt anyone out here? Like I said, does this work? I don't know. But what if it does? What if it does work? And we keep it from spreading? I have an employee. We had a nursing home in Farmington, New Mexico, and I thank God every day right now. We sold that last year, by the way. But there was a little nurse aide down there who wanted to become a medication aide, and her name was Barbara Bedoli. And I know her family isn't watching, but I think friends of hers probably are. She worked for me for 18 years. She died a week and a half ago of COVID-18. She fought it for 3 weeks. I believe she got it at the nursing home. She fought for 3 weeks. 18 years she worked for us. And I'm just heartbroken over it. Some of us don't know anyone that's died, but some of us do. And I get it, that's in New Mexico. But you know what? We're all neighbors. We've all been neighbors forever. I'm asking you, the county commissioners, to support opening the business, and I'm asking the hospital district to support it, and I'm asking the county health department to support opening these businesses and let people have a life. But I'm asking you, the county commissioners, to remember this right now, this moment, because I know it's just going to be a moment, and I'm going to be on the highway to my other nursing homes, and I'm not going to probably have time to come back here. Can you just remember this one moment when I'm asking you all to wear a face mask? And I'm asking you to put some rules in place to open these businesses safely, and let's let people live. And I'm asking the community that's watching to do the same. And I'm also going to just ask the Colorado Department of Public Health and Environment, not once have you come in our facilities across the state of Colorado, our nursing homes, and asked us how you could help us. You've only come in and given us citations and deficiencies and told us everything we're doing wrong. So I want the community to know we're working really hard to keep our parents and our grandparents safe, but I ask the community to do the same thing. We do have rights. We have rights, everyone. We have the right to not wear a mask, I suppose. But somewhere deep down in your heart, we were all raised here. And you also have responsibilities, and I'm asking you to be responsible.
George, did they give you, before you got the fines, did they give you a warning?
No.
They
No,
just
we
can't
didn't,
fine
and
you?
we didn't actually get a fine. What I'm referencing to there, Commissioner Sukla, is we were told by one of the surveyors to come in, and they were instructed to come in and cite every nursing home in the state of Colorado for a shortage of PPE. So we got a deficiency for a shortage of PPE, for not having enough protection. And it didn't really matter at that moment how much we showed them that we had ordered and tried. We still got us a deficiency. And then as that kind of blew up and I think got back to the governor, CMS, Centers for Medicare and Medicaid Services, put out the directive that they could not cite us for not having enough PPE. So the state survey agency came in and gave us a state tag, not a federal tag. And they're probably going to come survey all of our buildings now and go, well, Joyce likes to talk a lot, so well, let's go see how she's doing now. But someone has to stand up for that too. It's not right what's going on.
Joyce, my question is, who has oversight over CDPHE? Who is their boss?
You know, Keenan, I don't really know. Centers for Medicare and Medicaid Services is who comes down on us mostly. I don't know if the CDC, part of that CDC stuff also. I don't really know. I guess Bobby would have to answer that. I would like to tell you all that the CDPHE has been extremely kind to us. Extremely kind. Kate Lujan, however you say that, I'm not sure, but when we had to start testing over here, one of our requirements is that we notify our families immediately, all employees, if we have positive, I should say, the local, county, and the state. And Kate was our person. And I'll tell you, Kate talked me through a couple of nights on the phone, because I don't know, I think one night I sat down and I just had water start coming out of my eyes a little bit. There's a lot of fatigue setting in. And then I remember my staff is up here, and the staff is fatiguing out. I call it, the COVID fatigue. That's what I'm calling it. I keep saying, don't get the COVID fatigue, everyone. But they're doing it.
What about, you never did really talk about safe distancing or washing your hands.
Okay, thank you, because that was on my notes, but I lost my bullet points somewhere in there. So my message to you and the community is this: if you can social distance 6 feet, you do not need a mask on. I believe that. If you can stay 6 feet apart, you do not need a mask on. Now, if someone starts looking like they're going to sneeze, I turn my back personally, but you do not need a mask. But if you cannot social distance 6 feet, and know you can social distance, you need to have a mask on. And you need to wash your hands. And I carry my gel with me, of course, because I go so far at the gas pumps and everything. I make sure I gel my hands, but I'm going into these nursing homes, and I do not want to be the one bringing it in. But if you can social distance, you don't need it. You don't need the mask.
All right, any questions, commissioners?
I brought you one more thing. So,
Surely it's not as good as that cookie.
no, that cookie is really good. I promise you it's good. We made these up, and this is 2 of our residents. This is in front of the bird aviary at Vista Grande Nursing Home. And the message is really simple on it. If we can do this, you can do this. Help us keep our greatest generation safe. Wear a mask. This is some of our staff and some of our residents. And I just want to thank you, commissioners, and I'll keep going up and down the highway, trying to keep our elderly safe in this state and in the assisted livings also. But please consider the safety of opening these businesses. But I want them open too.
All right, thank you. Who's on the agenda next?
Thank you very much for allowing me to talk today. It's quite honestly a hard act to follow.
Tony, can you announce who you
Sorry. I can basically concur with everything that Joyce said. What's happened in her nursing home is no accident. The fact that she's had such success and there's not been an outbreak has been due to what the actions that they've taken, the precautions they've taken. And a lot of that is the wearing the mask, the PPE. We're doing the same thing in the hospital. You don't walk in our hospital without a mask. We've had people that have attempted to refuse, and quite honestly, at this point, that can't be allowed. We're going to protect the people that's in there. We're going to protect our patients, and we'll make sure that happens. Obviously, it's a little easier for us to do, a little easier for us to control, but we do believe that that's a major component of what has to take place in order to successfully open up the businesses. And don't get it wrong, we do want businesses to open. I see what's happening to the local economy, what's happening to the local businesses, and we understand that. We understand what's happened to our business. When you see the drop in revenues that we've seen over the past few months, it's pretty devastating. But we're fortunate. We've been in a position we have received some funding from the federal government that local businesses have not seen. So we're going to be able to sustain what we've been doing and stay ahead of the game as we move this forward. But again, we totally support opening businesses. I concur with Joyce. It has to be done in a safe, efficient manner, precautions taking, and the understanding that has to be followed. And if that can happen, and we can get the support of the leadership of this county, we fully support that. That was our position before, and it's our position now. We just want to make sure that we see the leadership take that position also and assure us that that's going to happen. If it does, we'll be right on board with everybody else. So, any questions?
Well, I guess it's the governor's mandate, right?
Absolutely.
Whatever he announces today, so whatever the rules are, the rules are.
Yeah. Mm-hmm.
It's pretty cut and dried, I would assume.
He announced yesterday for the restaurant.
Yeah, but he didn't give the details. He's supposed to give a speech today, I believe, later on. correct?
Like about right now.
Right,
I think it is about about now.
right now.
Okay.
His guidance on the restaurants and I think camps or some type
Got
of
day
camps.
camps.
Day camps.
Yes. All right.
For-
Okay. Thank you.
Thank you.
Oh, Tony, before you step down, you have your machine, it's been graduated or?
Yes, calibrated.
Calibrated.
Yes, it's been up and going. We used it, we've been using it since late last week, very successfully. Seem to be getting a consistent supply of orders. I think we're getting about 250 a week, is that right? So,
That's what you didn't test in?
Yes.
How many tests
So,
gets in?
so 250 a week?
Right.
So we've only had it a week, correct?
yes,
Since it was
we got our initial order of 250, and Karen, correct me if I'm wrong, and we're getting another 250 this week, and it looks like that's about what we're going to continue to get.
So is that just an allocation from the?
From the
from
manufacturer.
s- From the
Yes,
manufacturer?
yes, exactly. But yeah, it's been very good. Thank you
And
again
what
for
about
your
the
all's help in
Abbott
getting that.
machine?
I'm sorry?
What about the Abbott machine?
Abbott's still up and going, still using it. Again, it's a little bit slower to get tests because it only does one test at a time, whereas you can do multiple tests on the BD Max. It's supposed to be a little less reliable as far as getting positives than the BD Max. So, but we're still utilizing that too as we need. And plus, we're still, in some instances, able to send tests out.
And are we still only testing those that are showing the signs and symptoms?
That's sort of a point of transition right now. We're trying to evaluate that. We're hoping as more tests come available, we'll be able to expand the criteria a little bit about who's able to get testing. We actually will be talking about that this week on how we'll be addressing that.
Okay.
All right?
Which is good to know, because one of the things that Joyce pointed out, I definitely have had nothing stuck up my nose because I've never displayed signs and symptoms.
Mhm.
But, you know, that was the whole point of just the critical people that were being displayed signs and symptoms were tested,
Right.
not to waste valuable tests. So, you know, there's a...
Well, yeah, and that's the thing about this, you know, this disease. I mean, you or I could have it right now and not have a clue that we have it, and until there's some expanded testing, you're not going to know that. And that hopefully, as we get more test availability, we'll be able to do that. And I know there's some discussion going on now about a possible mass testing, and we're working through that too with the local health department.
Is that through the state?
Yes, I believe, and I think Bobby could probably address that better than me, but yes, there's some talk about possibly doing something through the state and being able to get more of the population tested.
So then are we going to become a priority down here?
We, you know, I think it seems we have some attention at this point about possibly.
We do, and I do think that we will be getting an amount of tests from the state. We're in communication with figuring out when that's going to happen, but it should be sooner rather than later.
So when are we going to have a definite answer? Because this is one of the things that I get frustrated with, is every time we talk to the state, and I've been on a lot of Zoom meetings with you guys, is we get no definite answers.
Well,
So-
we've gotten the answer that we're going to have the tests. We need to, as a community, there's lots of partners that need to be part of this conversation. So the conversation is ongoing, and we anticipate within either this week or next, we should be able to offer tests.
And how many?
At this point,
Here's the point I'm going to make, is that we and nothing against the Ute Mountain Ute tribe, they got their 2,000 tests, correct?
Correct.
Which basically was enough to test 100% of their population. However, in a community of 26,000, we have not been allocated 2%. So that's my frustration, is CDPHE, and I realize that we have to work with everybody. Don't get me wrong, I understand that. But I am to the point of, they want us to do this, and they're pushing this, and we're because we border 3 states, we're such a vital, critical area to McKinley and San Juan County. However, where is the help? Just like you, mentioned, where is that help? They're willing to come down, and they're willing to give you these 5 booklets, and they're willing to come and issue citations, but where is the help?
Commissioner.
My point is, where is the help?
Go ahead, Dr. Aiken.
Yeah, as Commissioner Candelaria, we'll have an answer for you within the next couple of days. It's really a logistical issue of how we're going to set this up. It's a lot of effort to run these lines and have enough staff to be able to do the testing, to take the records of the people that are being tested, to be able to do the follow-up and things like that. The state is very supportive. They've already promised us tests. I'm in touch with a couple of different agencies. I'm expecting to have an answer for the commission certainly by Thursday, if not sooner, as to when we're going to do this testing. So It's going to happen very soon. We're looking at maybe trying to do something next week if we can get this all put together.
So you'll have a number by Thursday, hopefully, if the state
Yes,
gets back to you?
yes.
On the quantity of tests?
On the quantity and on the location and the
Okay.
time and all of that, we're going to publicize it. We can't do 26,000 people all at once. And so we would, of
get
course,
that.
start
And
out
I
with a
didn't mean
batch of,
that.
maybe a batch of 1,000 people, and then try to run that on a regular basis if the logistics all work out the way we expect it to. The testing at the Ute Mountain Ute Health Center last week turned out to be a very successful operation. They did a great job on that. We're going to, ask for some support from them as well as others that will help us to get through the staffing and everything that we need. So yeah, this is going to happen.
And you
And
did
I'm sorry I
12
don't have an exact date today, but again,
1,296 tests down there in 2 days, right?
yeah.
Is what I have written down.
So what it is, it's the test that you're waiting on.
Well,
And
the
are they-
tests
is
have
there-
been
are there
promised to
shortage?
us. The tests have been promised to us and will be shipped as soon as we tell them that we have a date. And so really what we're trying to come up with now is a date, and the date depends on the availability of all the support that we need to get it done. And so, yeah, the tests, I'm sure we can get the tests within 48 hours.
Do you think that there's plenty of tests throughout the state then?
There aren't
Besides
26,000
those?
tests available for us, but there could be several thousand tests available for us if we space it out over a number of weeks.
The reason
And
I asked that question is you said that we're kind of a hot spot, or they're talking about us being a hot spot. We have 37 tests, right, that have tested positive. In Swatch County last week, in 4 days, they went from 3 to 55. And in Alamosa County, they're up over 50, which also borders. So why would we get the test before those? If we're thinking about everybody in Colorado, why would we be a priority over Swatch that had that many test positive in 4 days? Why would we be taking the test away from them?
Well, I'm not sure that we will be taking tests away from them. I can't speak for the CDPHE on their total supply of tests, but I know that we've been working with them since before the time that it was planned to do the testing down at the Ute Mountain Ute Tribe when they decided they wanted to do their testing and asked us for help. I know that the CDPHE was able to provide them with the test kits to do that. And at the same time, we had been having a number of conversations with the state about this. And again, it's a matter of pulling together the resources to be able to get it all done. But I think that they've made it clear to me that we could get at least 1,000 tests to start with, and that supply could continue once we initiate some of the community-wide testing.
And with the Ute Tribe, have you added any of the people that live in Cortez that took the test? So I've been told that 80% of their workforce is Navajo, Spanish descent, and white. So some of those folks live in Cortez. They work for the Utes on the Ute reservation. But will those tests be counted to our test? Or will they be just the Ute test? Another thing, will the Utes, whatever, they're positive or negative, they said they tested 60 people in San Juan, Utah at White Mesa. That's a different state. That's a different county. So are those figures for testing or positive, are they counted in our count as well?
Our county only counts our county residents.
So it's just by zip code, the way I understand it. Is that correct? No.
It's by county. It's by county, because Toyac has a separate zip code, but they're part of Montezuma County.
Well, I understand that, but that's relative to this county. So we have Dolores, Cortez,
Correct.
Mancos, Toyac. I understand that, but it's just by zip code.
It's not zip code because of Toyac. Toyac is part of Montezuma County.
Correct. Okay.
I have a question before we get too far off task. Does the hospital have the capability to test for antibodies to do the plasmological tests for people that might be carrying the antibodies to COVID-19?
Yes.
Do you?
Yes, we
Does
do.
that
We just-
BD-Max machine can, no, it's
No, the
another-
BD Max machine doesn't do that, but there's another machine that we already had in the lab, and we got the test kits to be able to do the antibody testing.
Good.
And our lab director said that we should be able to start doing that as of tomorrow.
Good.
Now, one of the caveats about the antibody testing, and we want everybody to be aware of this, and we're going to try to put this out on the Facebook Live and other ways that we have to release to the public, is that the antibody test is only given as a result. It's either the antibodies are either present or they're not present. It doesn't tell us how many antibodies a particular person may have. So while there are some useful things that we can do with antibody testing, such as determine how many people might have had an infection and never had a positive test previously, as well as give people an opportunity to consider donating some antibodies through their plasma to help those who are more ill. Until we know how many antibodies a person has, we can't use that information to say that you're definitely immune to COVID. So it's not like a badge of, super warrior kind of a thing that you can just go in there and do what you would like and not worry about catching COVID. Hopefully it won't be too many months down the road when we will be able to get what we call titers, which are levels of antibodies that will help to determine if a person may really well be protected against it. But right now, all we're getting is a positive or a negative because the, right. So that's the important thing about the antibody testing. It's great if people want to have it, but they can't then assume that they're automatically protected against COVID.
I want to send my attention back to Ms. Humiston. It sounds like you have been doing a lot of testing, both of yourself and of your staff and of your nursing home residents. Where are you getting so many tests to test that?
So when there was a shortage of tests, we actually, a colleague of mine on the Eastern Slope turned us on to a company called
Out again. Oh, fine. Good.
It's just got on. I got it.
turned us on to a company called Cirrus DX, and we actually contracted with a private lab out of Maryland. And we've been doing our own testing in the nursing homes now for about a month because, as I stated, we're going to do everything we can to protect our elderly and our disabled. And the only way I knew to do that is to get my own testing situation set up. The hospital didn't have enough tests to help us at that time. However, I do want you all to know that Dr. Aiken made it clear to me from the very beginning that he would prioritize us. And so I hope the community knows that the hospital has somewhat prioritized the nursing home, and I think the people in the community would appreciate that at this point since we had some positive. So what we do is when we get into admission, that resident, we test them ourselves with our own testing system, and we ship it off to Maryland, believe it or not, and we're getting a 24 to 48 hour turnaround. Anyone has any symptoms, we're testing ourselves and isolating. Any employee that has symptoms, we do our own testing and send it off. But as far as what's happened in the last couple of weeks since we had positives, the hospital came over and did the testing for us, and we did our employees with our own system, and they did the residents.
Well, thank you. You're to be commended for sourcing your own protection, and I think you're to be commended for that, Joyce. I think that shows the level of care that you see that's warranted by your people in your nursing homes and your staff and everything, and I think you should be commended for that because you found a solution to your problem and what your potential problem, and you did that of your own volition and out of your own pocketbook, I assume as well. So.
Thank you, Commissioner Tell. When this all first started, I think enough weeks have gone by. We all have to remember something. Nobody knew what was going to happen. Everybody was yelling for ventilators, right?
Yeah.
Remember the 40,000 for New York, because it was all about New York. It was. That's kind of how I felt about it. And nobody knew what was going to happen. So the hospital was dealing with scared people. I mean, they had their hands full, and they didn't need me bothering them. However, I think they would all say to you I wouldn't have been bothering them, but they didn't, and I thank you, Commissioner Tell. I just want to keep assuring the community we'll take care of our elderly people.
Thank you.
No, thank you.
I do have one.
Oh, okay.
So you talked about the support for the testing that we're getting ready to get set up. So we do have that. I mean, we have enough staff or whatever you guys deem necessary to be able to do that testing.
Again, we're trying to work through that. We actually provided 10 of our staff to Towak when we did that testing each day. They went down. We'll have to do that. I mean, quite honestly, our staff's getting a little burned out too, but we're going to do whatever we can. That way we can get the people. The other thing that's happening too now is we're starting to pick back up a little bit, so our staff's actually getting busier internally. So it gives it a little less resources to be able to use. But we're going to help whatever possibly way we can, but we don't know exactly what staff we will have available.
So then, are they the rapid tests, the BD Max tests, or are they the?
No, I'm
I think
thinking
you
these
said
will be
the
the ones that will be sent
48
out.
hours?
Yeah, these would actually be sent out to the lab. Yeah, yeah. It would. Yeah, if you take that many tests to do through the BD Max, it would take a long time to run those through. So.
Okay.
All right.
That was it. Thank you.
Thank you.
Well, there's probably not much left to say today. Hi, everyone. I'm Karen Labonte. I'm the Chief Nursing Officer, and I appreciate you, sirs, for giving me a moment to speak. I think there was a couple of things that I learned right away as soon as this all started. There were two things that we really had to think about to keep our staff safe is time and distance. We talk a lot about distance. We talk about that all the time, but we never speak about how long are you spending with that person who's positive. And now we know most people are positive and don't even know it. So I think that was the big thing that I learned is that how do I keep my staff safe by going into the room as small amount of time as they can, but yet keeping their distance. And we know that the PPE is one of the most important things we have to keep safe. So when I say time, I think it's important to know that you could spend 30 minutes with somebody or 15 minutes. It's the viral load that they're shedding that's important too. We can't measure that. We don't have any clue of how much virus they're spreading. So we say that if you stay less than 15 minutes with your PPE in a closed area, that you're probably going to maintain safety. The problem is that how do you maintain safety when you're over that 15 minutes? A lot of the studies show that the longer time you're spending with someone, the more chances you have of getting it. Now, the thing that the mask does is it protects you, it protects everyone else from you. Because if you sneeze or cough, of course the viral load goes up. And so if you're out in the public and somebody sneezes, Dr. Aiken's behind me and sneezes on me, I have a higher chance of getting it. The mask prevents that from spreading so fast. So I agree with everyone here. We've got to open back up. That's very important to our community. So how do we do that? By keeping the financial viability important and keeping each other safe. And I think there's probably 4 things. Hand washing, of course, is the most important thing we can all do. How close are we spending with people, and at what length of time are we spending with them? And then the mask to protect each other. Do you have any questions?
About the time part. On the time part, do you expect that we would have a second wave this fall?
It looks like it. And when you look at all the other past pandemics that happened, COVID-1, H1N1, you kind of saw it go down in the summer. Why? We don't spend as much time indoors. So that collection of people is mostly outside, which are a lot safer being outside than you are indoors. And the interesting thing is about indoors, at the hospital, our rooms ventilate the air every 15 times in 1 hour. What if you're at a building, like even this building, how often are the air being exchanged? That's a huge factor in it, and we can't really predict that. But there's so many things like that that play into that time and distance. And really the recommendation has been less than 15 minutes.
But so on the, you said that it's better to be outside. Mm-hmm. So we had several orders that forced us inside.
Oh, you did?
Right? Yeah.
Okay.
Stay-at-home order.
Oh,
Yeah.
stay at home, right.
Yeah. So then why does that make sense?
Well, I think because in the wintertime, most people are going to be inside. In the summertime, you're out hiking, you're where there's not a lot of crowd of people. Now, with that being said, let's say we had Mardi Gras here. There's thousands and thousands of people all bunched together, and we saw the rise in Louisiana after Mardi Gras. And that's because even though they're outside, you're so packed together that if you're next to someone, you're going to get it. There was a study in, I think it was in China. They had a restaurant, and they did the tracings. The man had it, the 4 people at his table had it, and then 4 other people away had it. So even though they weren't super close, they still contracted it because it's all about the viral load, how much time you're spending in that. There's just so many factors to it. And the scary part is you could have it and not even know it. I mean, it would just be easier if you just had some symptoms at least. So I think that's why it's important for the mask, because I just don't know. And if I sneeze, and allergies are pretty bad here, I sneeze a lot. You know, I'm protecting everyone else because I have the mask on.
Do you think on the time issue again, so if there is a second wave, and I think this is just a form of flu and there would probably be a second wave, is it, I know just personally that I seem to get better during the summer when I get sick than I do in the winter. I don't know for sure, I don't know if there's any science to that or not.
You know, I don't know. That's very.
I guess my question is on the Navajo reservation, they're getting infected at a heavy rate, according to what they say. So would there be the possibility, if you was to look out into the future, that maybe all of us that are taking all the precautions are going to be the ones getting sick this fall, and the Navajo Nation is the ones that their code talkers saved us, on World War II. They're going to end up coming and being our saviors because they've all had it already.
Right.
I mean, would that be something to look at?
Well, and the interesting thing, we talked about the IgG testing and the whole thing with antibodies. We don't know how long your antibodies are going to last because, that's been the big concern. I have it now. Can I get it 6 months from now? We just don't know. And so that's going to be the hard part. And the thing is that even if you get it, you could have no symptoms or you could die. And so it's just this huge range of how the body responds to it that we just don't know.
Isn't this coronavirus the same virus that produces our common cold, only a different variation, a mutation of that
It is.
virus?
So the coronavirus is, colds are one of the coronaviruses.
Right. So you can get a cold 3 or 4 times a winter. You can get colds forever, so you don't know if you're going to build an antibody to this or not, or one that's going to be effective in preventing you from getting it again.
You don't.
Yeah.
And I think that's just the reason that, those hand washing, distance, time, and mask are your 4 basic things that really protect you. Any other questions? Thank you.
Thank you.
I'm Dr. Kent Aiken, county health physician and hospitalist at Southwest Memorial. I don't have a lot to add to what's already been said. Everyone else has shared the information very eloquently, and I'm sure that it's pretty clear how we feel, that we very much want to see the economy reopen. I think that we're all in favor of that, that we just would like to see certain guidelines that will be continued through the members of our community for the hand washing, the social distancing, and the mask wearing. We're all here today because we are partners, and we've been working together since this started to try to keep this under control. Commissioner Sukla, your point about what's going to happen this summer, what's going to happen in the fall, is it better for people to get the virus than to not get it and therefore maybe have some immunity? Those are hard questions to answer because we don't really quite understand everything about the virus. How long is the immunity going to last? How much exposure do you have to have it, even if you don't get sick, to get an immunity? I'm hopeful that we would see more and more people that will have antibodies and that less and less rocks in the pond for the virus to jump through. It's kind of like if you're trying to cross the stream by jumping on the rocks, the virus is trying to jump from person to person. And if you get far enough out in the stream where the water's too high and there aren't any more rocks, the virus isn't going to have anywhere to go, and hopefully we'd see it disappear. But in the meantime, we have to do the best we can. And I think that there are ways that we can reopen safely, try to limit the spread, try to protect those who are particularly vulnerable. If a young person gets it and doesn't have much symptom, or even somebody my age gets it and doesn't have much symptoms, why, hopefully that'll give us some immunity in the community. But if there was an outbreak at Joyce's facility or one of the other long-term care facilities in the area, that can be devastating, not just to the people who get it, but also to the family members and to the community as a whole for losing those people. Thank you very much for your time. I'll be glad to answer any questions that you have, and certainly we are going to be doing community-wide testing sooner rather than later. The CDPHE is giving us a great deal of cooperation on that, and we're working actively to get the logistics worked out and should have an announcement very soon.
All right, thank you.
Thank you, Dr. Reagan.
Thank you.
Bobby Locke, I got one question for you. Could you come up to the, no, for Bobby Locke. Did you ask the coroner to change the death from alcohol poisoning to COVID-19?
Did I ask the coroner on the most recent death?
Yeah, on the man that
No.
died in the park. Did you ask him to change it from alcohol poisoning to COVID-19?
No. George and I communicated from, I think the gentleman died on a Monday. We talked on a Thursday morning. George called me because I didn't even know about it. And we talked about it, and we waited till he gave me the official result. And I have to put it into our system as a death, and it doesn't delineate whether it's a COVID-caused death or someone who dies and happened to be tested for COVID. It doesn't delineate those two. So that is why it showed up from CDPHE's point of view that it was 3 deaths, but it was not a COVID death. It was someone who died, unfortunately, who had COVID.
Okay, thank you. All right, our coroner's report is up. George Devers.
Good afternoon.
Afternoon, George.
Hi, George.
I don't have a mask on, but I keep my social distancing down because I don't like to get close to people unless they're good looking, and they don't want to get close to me, so I got it saved. Don't have a lot to report other than I'm COVIDed to death. I've had my fill of it. I'm tired of it. I'm ready for things to move on and go from there. I agree with everybody else. We need to get this town back open again. There's people starved to death and running their business to the ground. COVID's going to be here from now on, and some of these businesses might not. So,
George, I think this county should be proud of you in the stance you took on that COVID death, and you, with your pathologist and your findings from that postmortem examination, determined that gentleman passed away from toxicity from another substance, not the COVID virus. And I know you had pressures, and I know you had questions, and I know you had entities out there saying, wait, this has got to be a COVID death, and you stood your ground and said, no, this man died from toxicity. He may have had the COVID virus, but he did not die from that. So I think you're to be commended for standing by the principle and the facts of that autopsy and that postmortem exam of what it told you the true cause was. And I think it caused the state to change a lot of numbers in COVID related fatalities.
Thank you first.
Yeah.
It did, and I'm pretty upset because it hadn't changed all over the U.S. because the CDC has all the states recording it exactly the same way. And what's ridiculous is the state finally did call me back a week and a half later, and I got more questions answered. But the way they were recording it before, if I would have caught COVID 1st of March, it ran its course, fully recovered, and I'm going to be on their list as being a COVID person. Let's say I got killed in a motor vehicle accident December 24th, I became a COVID death, which is ridiculous. They don't track influenza that way. They don't track hepatitis. They don't track H1N1. They don't track AIDS that way. If you have it and it's a cause of death, that's exactly what the cause of death is. If you have it and die from something else, whatever else killed you, that's cause of death. So I don't know why they're doing that. I don't know if it has something to do with the $2 trillion COVID fund. I really don't know. But
Can you answer that, Ms. Locke? I mean, I don't understand why they're tracking it that way either.
Yeah, I didn't, George and I had multiple conversations over this, and because I knew that once I put it in the system, and I told you this, George, it was going to make our count 3. There was no way around it because I had contacted CDPHE. I had phone calls, emails, all trying to say, this was not because of this, so how can we make it so it doesn't? Anyway, it took George, and I think there was wasn't there another coroner who was questioning this too? Anyway.
there's a physician up at a nursing home in Denver, yeah.
So it took that, for that clarification, and it has been delineated now, so there is COVID caused death, and then people who died that had COVID. They're separating those numbers now. I can't explain why. I don't know. I just know I knew that was going to happen, and
Yes,
we
we
were
can.
trying to
Yes, we can.
navigate away, but having a physician and a coroner both voice their concern, I think, pushed that envelope to have them delineate the two. So, I don't know.
It's frustrating.
What do you want the numbers to say?
What do I want? I
No,
want the
that's
numbers
what-
to be
that's what I'm
right.
saying, that's what CDPH, what do you want the
Yeah.
numbers to say? And they want it to say COVID, COVID, COVID. I mean, yeah, that's exactly
It,
what they want.
it's no different than suicides or anything else. If I'm tracking numbers of suicides, it's going to be a suicide, and I'm not going to fudge it one way or the other.
Sure.
It's same with COVID deaths, whether it's influenza. I don't switch any of those or try to pad any of those either way. If you're doing research, you need to have numbers, and you need to have correct numbers to do correct research. So I don't know what the reasons are for, but apparently they have their own agenda somewhere.
I have a follow-up question for Bobby, if I may. And could you come to the microphone, because Kim says she can't hear you. The mass community testing that's coming up, just so we're clear, because I think up to this point, all of the testing has been done either through the hospital or Cedar Diagnostic. Is the health department going to be running the show on this one? Or?
No, it's still going to be, we have communication with CDPHE, but this is going to be, again, the hospital partnering with public health, and we'll offer it. We're still logistically working out where it's going to take place. That's all part of the conversation that's going on. But we are not doing the testing. We are doing the contact tracing. So,
Okay.
yeah.
So the hospital's going to do the actual performing? But
Correct.
I'm trying to make sure I understand. CDPHE is giving the test kits to us or to
Yes,
the hospital?
well, no, they'll probably send them directly to Alan at the lab at the hospital, I would think, just like we've been doing.
I'm just trying to clarify roles in this in my own mind.
Right. So we, as the public health department, obviously are integral to this whole process, and we're partnering with the hospital. We may even be able to, and I know that we had mentioned this before, we might be able to ask if anyone down at the Mountain U may be able to assist with this testing, since our hospital employees went down there to help with their testing. So I think it's a really good partnership, so maybe we may be able to get some assistance from them too for the testing that we do up here. So I don't know. I mean, we're working on it, and it will happen sooner rather than later. So I'm thinking more like next week, like Dr. Aiken said. Did I answer your question?
You did, thank you.
Okay.
If I may just add very quickly to that, there are, again, a lot of components to getting this organized. The tests will come from the state. CDPHE is going to provide us with the tests. We have to make sure that all of those samples, once they've been collected, are handled properly so that they're still valid when they're shipped out to a laboratory to be tested again. So we need to make sure that the courier service for that large a number of tests is intact. We need to have people that actually do the swabs. We need to have a place to do it. We need to have traffic control. We need to have people to record who's coming so that we know who to get the test results to. So it's just a lot of things that have to come together. They've come together for a couple of different things. Testing at the nursing home, they've come together for testing at the tribe, and they're going to come together for here. So that's the whole issue. It's a collaborative effort, but it will be involving a lot of um, efforts on part of the hospital coordinating with the health department.
Thank you.
Any questions for Coroner?
I have none. George, thank you.
Thank you,
Okay.
George.
You guys have a good
Really appreciate
afternoon.
everything you've done for this community.
Thank you.
Okay, we have our emergency manager is up next, Jim Spratlin.
Yes, sir. Afternoon, Commissioner,
Good afternoon.
Administrator. Looks like everybody has said everything I was going to kind of review, so. So last 7 days, we've been pretty much, we're testing various individuals throughout the county. You heard a lot of that. Locating and distributing needed supplies. We do have more supplies en route. Not quite as much as I thought, but we're getting some from the state, so that'll be a good way to start with our PPE. Monitoring public response to the governor's guidelines. We're going to continue that as we move forward. Building a system to identify our special needs population, which we're getting that form around. We're going to start really looking at this system that we're trying to build so that we always have a good count of our people out there in case of any disaster, of course. We're monitoring the long-term recovery, and we'll continue to assist the businesses in recovery. We were on a call, Commissioner, we were on a Thursday? Yeah, one of those days.
With the MBT?
Yeah.
Thursday.
And we discussed that survey, and we got a few more questions out there as well. That survey, I just talked to Susan this morning. She ran it through the other two chambers, all three of them together, cleaned it up, got it ready to go. They're going to send that survey out this afternoon, and they're going to put it out in the paper and Facebook later this afternoon as well. So we should get all those results. And the results will be calculated on the survey to the businesses, should be calculated and put on the Dolores site. So we will always continually see what's going on those results.
And what he's talking about basically is the snapshot of time now in comparison to what we had probably a month ago.
Yeah, a month or so ago, right.
So-
right.
That's the survey questions you had requested, Commissioner Super.
Right. Well,
Yeah.
there are more there, but they tried to keep it, I think, 15 questions so that the
Yeah.
survey doesn't take too long. It would be a very
7
short
minutes to
survey.
take is what she said. And we have, of course, name, email, business, et cetera, but part two has 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We tried to keep it to where 11, 12, 13, I think, and I think Susan's on the line if she wants to jump in, but we wanted to keep it halfway short because, you know, when you start doing a survey, you're like, I'm done.
Yep.
You don't want to do anymore. So.
It's got to be quick or you're not going to.
Right. So that was a really good meeting, actually. So we're moving ahead with that. We're still compiling a lot of data and usable formats, trying to get our data systems going. That's working really well. You've already heard from everybody else, but we're continuing in contact tracing when we get, you know, a live patient out there somewhere. We're still building a COVID recovery center just in case anything does occur. It's no cost. It's just making sure we're ready to hit the ground running if something does occur. We get too many, you know, positive tests. And then we developed a new incident support plan for the next 7 days. Normal operations, transportation, airports, buses, you name it. We've got everything's running fine. I think Jennifer's going to give her spiel coming up. I won't take her glory away. Communications, normal operations and all of that. Public Works, Road and Bridge, Engineering, all normal. Firefighting operations, normal. We did have a fire just west of Toyac. We called it the Sage Road Fire. Started with 2 acres. Started catching pretty good, burning pretty good because it's pretty dry. But they hopped on it right away. We got the seats, we got the, you know, the helicopter. We dumped it on there, got it out. 10 acres about. So.
Do you know how the fire was started?
Not yet. No, do not know the cause at all. So I'm waiting to hear back from Toyac. But they did knock it down, so that's good. We believe it's It wasn't dry lightning, I can tell you that.
Not much lightning in there.
No, sir, no. So it was probably accidental or at the fault of somebody, but cause unknown. And that was on the 20th. Emergency management and planning, we're still planning, getting situation reports out. You have the latest one there. I believe you have the latest one because we tried to clean it up for this morning. Again, the state, I just talked to her. They are sending me some PPE, so that's good. You already heard about the BD Max, so I'm excited that that's around. Public health, you've heard a lot about public health. It looks like our updated stats, 34 confirmed positive cases, 37 as of today. And then 640 negative tests.
17 recovered, right?
And 19 now recovered. Yes, sir.
Okay.
And 15 active cases. And then I have a timeline there for everybody so we can kind of keep track of it.
Jim, let me ask you a question. Of the 15, do we have any that are actually currently in the hospital, or are they
To my understanding, no.
just quarantined?
But I haven't called them today.
Okay.
But to my understanding, there isn't any. But survey, we talked about that, long-term recovery, and then our PIOs are working pretty hard. Mesa Verde is up and running, so we saw that in the paper, so that's pretty good.
I was there yesterday.
Yeah? How was it?
Yeah, look, can't go down to any of the ruins or anything, but they've got the motel open. They've got curbside service for the Metate room up there so that they can, I think, take care of food service to the motel, the residents that are staying in the motel and stuff. And you can walk around to overlooks and sightsee and look at the ruins from the perches, but they weren't running any tours or any of that stuff into the ruins. So.
Right. That's what Christy was telling me. I tried to.
And there was a fair number of people up there.
Good.
Yeah. All out of state.
Well, too bad we don't have tax dollars, right? Yeah, well, I was talking to Christy on everything that was going on in Cliff, and then I called her this morning. She was pretty busy, but I was going to see how it went. How many people showed up and everything. So, good. And then our estimated cost, it fluctuates. It depends on when we pay a bill or don't pay a bill, but we're around $152,000. And the $80,000 is the loan, $35,000 is the testing unit, and the rest is laptops, PPE, things that we've been spending on. And we pretty much, we're not doing much more spending than I'm aware of. So,
what as far as the PPE are you still short on? What is your biggest shortage?
She just called me and said there's one en route, which is the stuff I really wanted, which is the face shields for law enforcement. Some of these masks for law enforcement. For the prisoners, we just pull the wire out. And I believe some N95s are coming as well for the hospital, additional. And healthcare, definitely that was the big deal, is trying to get more healthcare. So the last one that we tried to work with was law enforcement and healthcare, because we got the hospital set up pretty good. But they were reviewing my 6 orders, and they're going to fulfill some of the 6. I thought they were going to send me everything, which would be like 10 pallets, but I don't think that's the case. So we're getting just enough to get by, and then she just asked me on a text message to give her a call, and we'll go over the rest really quick so we can get another order. But
just to clarify, that's coming out of the state's pocket, correct?
Yes, that's all the state, correct.
Which ultimately comes back to the taxpayer either way.
The taxpayers will pay this, yes, but it's minimal for us, as we talked about before, and I don't want to say it out loud too much, but we seem to be the stepchild down here, and I'd like to make sure that we're not. And so voicing
You figured that out, Jim?
Yes, sir.
I'll tell you.
Done that.
How long have you been on board with us?
68 days or something, and
Yeah, I'll tell you what, you're a quick learner.
I'm a quick learner, and I realized that when I worked for the Southwest, that we're the stepchildren. So hopefully we get what we need when we
keep plugging.
We scream for it, right? And we are the voice that we got to keep screaming for.
You keep plugging.
And so there you have it. Another great week, good weekend too, right?
Yes.
Yes.
Any questions,
Good
commissioners?
Memorial Day weekend.
I've asked all mine.
Thank you, Jim.
Thank you.
Thank you.
Thanks, Jim.
We have a liquor license change of premises for Maker's Brewing. Jerry's here.
Yeah.
Good afternoon, Jerry. Hi.
My name is Jerry Frizzell. I'm from Montezuma County Clerk and Recorder's with liquor license. We have a report of changes for the Maker's Brewing Company, LLC. They're wanting to add more room outside for expansion to be able to serve more people outside. And they are at 484 East Frontage Road, Mancos, Colorado.
Is that the one that moved into the old kayak building property over there on the north side of the road, north side of 160?
I do believe so.
Thanks, Heather. Yeah.
The old Forest Service building?
We had some complaints from, on them before, I'm not saying that how I'm gonna go on this, but if they're wanting to expand their outside activities, their serving and all that outside, we had some complaints from people across the highway in the summer months of the noise coming from their bands and stuff that they were doing, outside bands, and had some disturbance issues with them. If they're talking about expanding that outside presence, I think we may be opening up.
They are. We have a map here of what they're wanting to expand to.
Is
And
that
are
really?
they expanding on the roadside, or is it to the south side of the building? I need to see how that expansion.
Wouldn't that be just for the town of Mancos to deal with that as far as?
It's
I mean, the
outside.
liquor license.
It's outside their town limits.
So it is the
It's-
very northeast one.
Yeah,
Then.
as you're going out of town, it's that one that sits right off the highway just past the Forest
Like-
Service fence, that Forest Service
Yeah.
building, just past, beyond that, yeah.
It's barely out of the city limits, though, isn't it, Heather?
Yeah.
It's right outside the city limits. It's like one lot outside of city limits.
So a fence line.
I've made a note.
Yeah, I think a
Have you
fence.
talked of annexation?
We would need to get the property owner in between to annex. And,
Gotcha.
I've been talking to him for 4 years.
Yeah.
I'll keep talking, but I don't know.
Yeah, and I don't want to, this business, I think, the lady that owns and runs this business is a fine lady. I just think that they need to address their noise levels outside of that, because we had people down there taking decibel readings and stuff on that property, and it was an issue, and I had several phone calls over it and stuff, so I think I would like to see somebody reiterate to them that their noise level has to, we don't want to hear the noise level complaint again. Yeah. Okay. That's my only consideration with this.
Is expansion towards the highway?
Kind of east end. Or
Probably to the east.
to the east.
Yeah. The not public.
Okay, I didn't talk to the people the commissioner would tell to, but with not knowing any of the details, anybody that's got a business on a highway, if they think that they ain't gonna hear any noise, I mean, I don't know how people live next to the highway, to be honest with you.
Yeah.
Harley goes by or semi, and the road traffic, I mean, I think it's kind of a given if you choose to
Well,
live against the highway that you're gonna have
No,
noise.
these people aren't living together. They're over in a grove of trees over by that RV park, that new RV park right on the Mancos River there, just across the river from that
Oh, okay.
RV park.
So they're way to the south.
They're to the
Yeah.
south and
Yeah.
a little bit to the east.
To the
And
east,
then a
yeah.
grove of trees, and they're still getting a lot of noise.
By the river, right
Yeah,
by the river.
Right by the river, right. So Heather, I'm gonna leave that to you.
I will take care of it.
Thank you, thank you. I appreciate you, Heather.
To the appropriate party.
I appreciate you, Heather. Yeah.
It is in Mancos. I guess not really, though.
She knows all about it, she'll take care of it, that's all
You're probably waiting for something that I don't have in front of me.
Oh, yeah, I'm sorry, yeah. Better give him the paperwork,
Oh, I'm not sure this is the right paperwork.
For Mancos Brewing?
Yeah,
Yeah, that is, that was part of this.
so that's the application.
Yeah, that's
Okay, so this is the one I need. So I would move
Joyce,
that we
that is an
accept,
impressive display.
Well, I'm trying to not be rude.
Well,
so I'd move that we accept the Mancos Brewing Company LLC's license at 484 East Frontage Road, Mancos, Colorado.
Second.
Motion and a second to approve the liquor license change of premises for Mancos Brewing. All those in favor?
Aye.
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 We're just getting used to that.
Well, I guess so.
Thanks. Back and forth.
I would like to bring up that now we'll have the Lodgers Tax Committee. But you know what, Joyce, you came for, you asked a question. And my grandmother's in one of your nursing homes, and if you tell me I got to wear a space suit to go in there, I'll wear it. But I'm not going to wear a mask here. And it's just, but I understand. Here, I said. Yeah, no, I said I'll wear a spacesuit. You know, I'll dress in pink, whatever we got to do. But
What do we have to do to get you to dress in pink?
let's go ahead with our Lodgers Tax Committee.
We wanted to ask, since Brian and I both are going to have to talk to you.
Sure.
and,
Sit
Yeah.
down at the
going
table,
back
turn
and
that
forth.
microphone on.
Can we turn it on?
You sure can. Just hit the button.
Okay. And we'll kind of be at both ends of the table.
There
Both
you
ends
go.
of the table, you're fine.
Get your tape measure out.
I didn't even know how she can fit them all in that suitcase.
I know. Oh, my Lord.
Good luck.
Hello, gentlemen. Good afternoon.
Hello, gentlemen. Yeah.
I hope you're easier than the last ones, are you?
Well, we're talking about money. I hope that
Oh, okay.
rather than talking about the germs for a moment.
Yeah, let's talk about, let's
Just talk about
money.
some money.
Yeah.
I think we're all sick of talking about
Okay.
the germs.
All right. First off, do we need to introduce ourselves to the YouTube?
Yes,
people?
if you
Sure.
would, please.
I'm Lee Cloy. I'm the chair of the Lodgers Tax Committee that reports to the commissioners.
My name's Brian Bartlett. I'm the secretary of the same committee.
Okay. Our minutes from the last meeting are up there. We had to wait until things could kind of calm down because of the stay-in-place order. But Brian's breakfast room at the Baymont, we did place the chairs like tables, so everybody had their own table, the 6 members of the committee, more than 6 feet apart.
Wow. Good on you. Good
Okay.
on you.
So we went over some things, especially concerning the current economic situation, of course, and lodges, of course, need outside people driving through. And we covered how things were going with the larger motels and so forth, and also with the campgrounds and the trailer parks and the mix, especially in Dolores. And I think, Brian, do you want to share some of those numbers real quickly?
I'd be happy to if I may, if I could have your indulgence for just a minute, please, gentlemen. I'd like to share some numbers with you.
Hold that microphone a little closer.
Yes, sir.
to Brian,
Thank you.
so everybody can hear you.
Thank you, thank you. I've had the pleasure of being employed at the Baymont Inn and Suites Hotel for the past 15 years. It used to be the Comfort Inn, and we changed about 10 years ago. We have great ownership there. I want to say that throughout this whole situation, they've done a great job of getting hold of protective personal equipment and all that kind of thing, masks and gloves, keeping it safe so that we can serve the people that are still coming through. But I also want to tell you gentlemen, very honestly, last year, the contribution to this Lodgers Tax Fund from my organization was approximately $40,000 based on the percentage that we contribute. This year, based on the revenue that we're looking at running, and again, I don't have a crystal ball any more than you do, but 15 years, what I see coming down the pike, I expect that our contribution will be between $5,000 to a maximum of possibly $10,000 this year. That's how far our numbers are off, gentlemen. And I need you to know that because we kind of see this stuff early. April, we were off by about 80,000. May, we're off by over 200,000. Right now, I have some numbers, just for example, for last June, this was June 1st to June 30th of 2019. The room revenue just in this hotel, this isn't profit, this is revenue, money coming over the counter, $312,280. Pretty good, pretty typical for a June for all the years that I've been there. Right now, this morning, I printed a forecast, and I'm forecasting $28,436 on the books. That number's grown about 6,000 in the past 30 days. So I just want to warn you.
What we have for distribution next year is going to be, instead of the 196,768 that we have right now,
Yes, sir.
if that holds true, we're going to have maybe 40,000?
Commissioner Candelaria, we as a committee talked about this, and our number was between 25 at the very, very lowest end to 50,000 at the very best possible end. A number you should be aware of, that we find it important to share with. I'm also happy to say that as far as I know, life is still fatal, but decisions about our economy don't have to be. So there's the hope, and that's what I'm hanging on to.
I like your saying.
Thank you.
And to add to that, we, Commissioner Candelaria, we did discuss quite a bit about what each hotel or RV park or what have you, we kind of said, well, 25% to maybe 33%, and we played with that number you just played with. And one of the things we came up with is we wanted to hold money back next year. And the people that were representing like Dolores and Mancos, we wanted them to make sure that those chambers know that this may be the only money you get for a couple years. So when we went through the discussion about what they asked for and what we wanted to recommend to the commissioners, have in mind that you got to get prepared. You're getting sort of like a good set of dollars this year, but next year, even with our holdback and what may come in, we're going to have to make some real hard choices. If you look at our sheet at the bottom there, we're holding back $35,168 in our recommendations. You add 40 or 50,000 to that, and we're not going to be able to help too many people with it.
Right, you're going to be looking at 70,000 total if you expend all of that compared to your 197 right now.
Yeah. So, and so we had kind of a lively discussion, and we kept the rodeo at what they asked for. Hopefully we're going to get a lot of people at the rodeo in August because it was rescheduled. The Welcome Center with Mesa Verde, we're hoping if tourists do come in, to stay optimistic, they will kind of guide people and direct them and show them, tell them what is required in this county as far as safety and so forth. Because a lot of us, as Brian was saying, you know, we done bought the masks. You hand them to the customer when they come in if necessary, if they don't have their own, and help in that way. But we did have to cut the requests, like with the Welcome Center, by about 5,000. We knocked 15 off. Mesa Verde Country, as you see in the list. Mancos Chamber, we knocked off 6,000. Galloping Goose, we only gave them 2,500 out of their 10,000 requests as a recommendation. KSJD, this was the first time they asked for some money, but they don't, this particular time, they didn't really meet the criteria of heads and beds and assisting us in making money. Good. So that sounds a little crass, but anyway, we denied putting a request for them before you. Also, the Cortez Cultural Center, a lot of the stuff they do has already occurred, and so we had to cut them back because they don't have the Birding Fest this year, and they don't have a few other things, and they're not doing any dances right now either. But we want to help, and think the county would want to help them stay viable going into the future. And then, of course, Dolores Chamber, we cut them down same to as what Mancos is getting, which is basically 7,000. And that's like $161,600. But the committee was kind of fighting with itself because we wanted to have a contingency as sort of some seed money going into next year.
I agree. And that's
So-
why we discussed that last year. I mean,
It's a
you guys
prudent,
got-
it's a prudent thing to do. And it gives you some maneuvering room if some special request or something happens or something comes in that you feel like you really need to participate in it. You've got some discretionary money there to do that with. And you've treated all your requests very evenly, even-handed, and I think you're running your business right.
Thank you, Commissioner Tell. One of the things about that is if something like we really have a good July or August, and we can put some money to a special, like, come here, quick, we need more cash. That's what we want to do. So, anyway, that's where we are right now. And, one thing I need to bring up, we are going to experiment with, and I think the whole board was talking about electric vehicles and so forth. One of the things we came up and we presented, and we used Kurt Swopes, he has the outpost in Dolores, and we discussed what a charge is for an electric vehicle. I know some of the places are charging about $8 per charge. But one of the things that was discussed in the fact that your RV parks already have the 220 there. And they have the 50 amp breakers and so forth. They might need to put a meter on it, but they already got them. So he has now how much it costs to charge somebody, and we can experiment with maybe how do the lodges get involved with that. Well, we got a test case, and Kirk is going to begin doing it as he's only charged charged up a few vehicles. But it's almost like that's a built-in charging station as an RV park.
Absolutely.
So maybe it'll be some more interesting funding coming down the line for electrical vehicles. So we'll see. I mean, somebody may say something about this and say we're all wet, but a RV park is almost like tailor-made. While the trailer's being hooked up, you pull up one of your open spots and have the vehicle charge. And he charges them $8 though, or $10.
Sure.
It might be going up. It may have to go up a lot here, real quickly, if we can get everybody on board. We'll see. Okay.
Wow.
Any questions?
No, I think that's smart. You're right. It's a natural form. They've already got the power there, the breakers. It's a natural thing for them, and who knows what that'll attract as far as business with an electric car. You never know. Yeah, I think good thinking. Good thinking.
You do have a full board still, correct?
Yeah,
Okay.
we do have a
Okay,
full
good.
board.
Good, thank you.
All right.
Well, then I guess that I would move the tax fund disbursement for the year 2020 in the amount of $161,600 as presented by the board.
Second.
Motion and a second to approve the amount for our, of $161,600 for the lodger's tax for the various requests. All those in favor?
Aye.
Aye.
Yeah, glad you can do it this year. I know those chambers this summer probably really, I think all of them are gonna need every nickel they've got coming in there. It's gonna be a tough year, tough summer.
And I would say that they probably worked harder this year than they have in years as far as.
They have worked pretty hard.
Yeah, they've been-
All of them, the
There's money.
tri-chambers are working very hard for the businesses right now, and that is very good that they're still able to get their disbursement for this year. I hope it changes,
Right.
and next year,
Well, it's going to be tough next year.
I
We'll
know.
see. They may have to do some creative financing or something. We'll see.
Next
you,
year's
gentlemen.
based on what you bring in this year. And
yeah.
Thank you.
You're
I
welcome.
appreciate it.
Thank you, guys.
Have a good afternoon. Gina Montoya, the Social Service Director, and Lori Higgins. Gina, are you there?
Hi,
Hello, Gina.
Gina, we can't, there, we can see you now.
can you see me?
There you are.
Could you do
I
that
have a
once
weird
again?
camera, sorry about that.
Go ahead, Gina.
Okay, do you have the minutes, or we're just going over the financials first?
I've got the record of proceedings up.
I would move that we approve the record of proceedings for the Department of Social Services of Montezuma County for April 28th, 2020.
Second.
Motion and second to approve the Montezuma County Board of Social Services regular session on Tuesday, April 28th, 2020. All those in favor?
Aye.
Aye, he did that on purpose.
I wouldn't mess.
Thank you. And we'll go ahead and show the financials
Yeah, you
for
spend a lot of
April.
money. You spend a lot of money.
Okay, I like to kind of discuss what those financials look like for April.
Commissioner Tell is very upset, Gina. You better be doing a good job on this.
That's
Okay.
a lot of money.
Okay, well, I compared the financials from March 2020 to April 2020. And if you compare those months, if you look at the food stamps amount in March, it was $503,620.
It's a million.
And if you can look at April's amount, it's $1,081,722.
Did you get
So
that?
I calculated the increase from March to April in those monies, and it's 115% increase
Did
in
you get
food
that many
stamps.
more people to qualify for food stamps in a 30-day period?
That means that food stamp amount, the monies were raised to the maximum amount, which the federal government said will give them the max amount. That's what you're seeing here.
Oh.
What is the max amount?
I don't know what exactly the max amount is, but for each SNAP recipient, their amounts went up. So you will see the increase
So are the
for that
feds-
month.
Are the feds going to backfill that for you, Gina?
Well, this is the thing, is that the state now is looking at, we're going to get more SNAP new enrollments, and that means that we need more staff. And I'm expecting the
Who needs
state
more
to come
staff?
up with the staff allocation if that's the case. It shouldn't be a burden on the county.
Who needs more staff?
Because SNAP is food stamps, SNAP is supplemental nutrition
Right, but
assistance
you're saying
program.
you're saying more staff. Who needs more staff?
I'm just saying if the enrollment increases, which it may in the coming months, because right now, people aren't coming in to do new enrollments because they've either gotten their stimulus checks of $2,400 and maybe they don't think they qualify for food stamps, but in actuality, they do, because we don't count the stimulus checks, that amount, as income. So we may have more enrollments coming on board for the month of June and further down the pike.
Can you,
the
can I
other-
ask you a question? With nobody coming to, actually to the building, or, I mean, that it's been limited, can you cross-train any of the other departments and to go over to some?
Larry Don, we're gonna do whatever we need to do in order to not have an issue with staff. I'm not looking forward to this, because what the state wants to do is have a regional hub with eligibility techs, and I think that's the wrong route to do it in, because we know our community, number one. Number two, the state has tried to use a hub for Employment First. I don't know if you remember this, over a year ago, Employment First was supposed to go through the state office. You know what? Their vendor wasn't working at the state. So that whole program, Employment First, failed the state. So I don't know what that's going to look like in the future. There's more to come. Everything is changing. And it's really unknown at this point in time. I can't tell you what's going to happen. The other thing is that people are on unemployment benefits, plus the fact that they get an extra $600.
Yeah.
Some folks aren't coming in to apply for TANF because we count the unemployment benefits plus the 600. So you may have someone who's unemployed who's getting the 600, but they don't qualify for TANF. If you look at the TANF amount, it went up 4,000. So TANF went up at least 4,000, as you can see from March. Aid to the needy and disabled went up just a little bit.
Gina, can we ask you a question? Because Shaq, we asked him, he did some figures. If this trend continues, your budget would be over $9 million. Will the state backfill that?
They will have to backfill it.
I mean, you know 100% sure that they will?
Well, the SNAP program is a federally mandated program, and they're going to have to backfill it. I don't know how else we could absorb it.
Well, if you have to increase your staff, that comes right along with the backfill of the money. We're not going to do unfunded mandates from them and not have them push down upon you, Gina, more workload and more qualified people and more qualification without them providing the money to do your staff. If you have to have more staff, we're not going to do it.
I agree with you totally on that.
Okay.
I'm on board with that.
Okay.
You know, the state needs to come up with a plan that's going to benefit the counties and that we can serve our community.
Yeah. That's incredible to double that amount in 1 month, man.
It's a little more than double.
A little more than
600,000.
It's 115% increase from last month to this month.
That's insanity.
And that's quite a bit.
Good news today. Keep it up.
That doesn't mean more enrollments. Let me express that. That means that they got the max amount of benefits.
Right.
Doesn't mean more enrollment, because I told you what the enrollment numbers were
Right.
when I last talked to you.
Well, Gina, you were told to do that max amount by the state, were you not? To take those EBT cards and load them to the max?
That was the federal government's
Right, federal
mandate.
government, okay, and did that all electronically, correct?
Yes, we didn't have to touch it.
Right. So,
Okay, but I just want you to know, I was looking at the enrollment numbers from, February was 241, 282 in food assistance to 258. So the enrollment didn't really increase from February to April. So there are two different calculations.
So what that would mean was that, well, their amount would have had to double, correct? It would have had to double or a little more.
115%.
So what is the base? I mean, is it 1,000 a month? Is it? I mean, are we allowed to say that? Or?
I think it's different for every family. It depends if they have 1, 2, 3, or 4 children. It's based on what assets they have, what income's coming in, and the number of children. I can't.
Okay, that's okay. I understand.
There's a lot of figures that go into how a person is eligible.
So Gina, you said that was federally mandated, is that correct?
oh, yeah, it is. Gina? Oh, sorry, go ahead.
Gina?
Yes,
You said that was federally mandated, is that correct?
yes, it's 100% federally mandated.
Dare I ask where the feds are going to get money?
That's above what I know. I can't speak to where those monies are coming from.
Gina, could you give me an average of the EBT cards, what the maximum amount average was on those cards when you loaded it to the max?
Okay, I can get that research done for you.
Thank you.
Can we?
You want to know the max on the EBT card?
Yeah. When they told you to load those cards to the max and you did it electronically, I'd like to know what the maximum amount on those EBT cards are.
Okay, I'll figure that out.
I wish the money could just be spent at small businesses and only one roll of toilet paper.
So I would move that we accept the payables for the Department of Social Services for the month of April 2020 in the amount of $1,693,878.74.
Second.
Yeah.
There's been just a second, Gina. There's been a motion and a second to approve the financials for our Social Service Department for the month of April 2020 in the amount of $1,693,878.74. All those in favor?
Aye.
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 I thank you much. Have a good day.
Thank you,
All
Gina.
right. Thank you.
And
Let's roll right on here. We got Veterans Services with Rick Torres.
Good afternoon, Rick.
Good afternoon, Rick.
I think I'm going to stand up and sit in a
All
while.
right, you hit it wherever you want.
Good
Go ahead,
afternoon.
stand up,
gentlemen.
then.
How are you?
Good,
Hi,
good.
Rick.
Good.
Keep 'em busy.
Yeah, I'll bet you are. I would like to make a motion that we approve the Colorado Department of Veterans Affairs County, whoa, you rolled up, scroll that back down, please.
Check.
County Veterans Service Officers Monthly Report and Certification of Pay.
Second.
Motion is second to approve the County Veterans Service monthly report of pay for the month of April 2020. All those in favor?
Aye.
Aye.
Thank you, Commissioners.
Mm-hmm. Thank you.
I'll just grab that before I leave. To go on into our report, I always like to begin by looking at the year prior, and you'll be able to see that in April of 2019, we had 204 veterans and their spouses, thank you, come through our office. And for some reason, in April of 2020, we had a total of 21 people come through our office. One was new.
I wonder why.
So yeah, that was the month that this whole thing actually hit us, and we did our shutdown to reduce the curve, or whatever, flatten the curve. And so we did our part by we did see in person 21 folks. One was new, and so that was a decrease of 183 people over the previous year. So we'll leave that where it is. Everybody knows why. I did get to sneak in 3 nursing home or house calls before we actually shut our office down. No outreach events. One event, it was probably a meeting with one of the organizations in town. In April, we filed 4 claims. The VA has decided during April 8 of our older claims that were pending. 6 were favorable, 2 were denied. If you look at the figures, those 6 folks that won claims in April, combined, they brought in a little over $8,000. In a year, that'll bring in a little over $96,000 to those veteran families. And they received $31,984 in back pay. So far through year to date, January through April of this year, all the folks that have won claims, it's a little over 41,000 times 12 months, slightly under $500,000, and in back pay a little over $160,000. So we're happy about that. Since we've opened, I know it's not on my list, I'll be as brief as possible. We're averaging about 4 people a day so far. Today marks a month. I think we opened on April 27th? Yeah, 27th. It was a Monday. So today, right at a month, and we're averaging about 4 people a month. So I'm okay with that. We're still taking our steps to wear the mask. Everybody's seats far apart. Everybody sits out in the waiting area far apart. We wipe everything down. So far, no problem.
You said 4 a month or 4 a day?
I'm sorry, 4 per day.
Okay.
I'm averaging about 4 per day.
Okay.
No, I'll just go home if it's 4 per month. No, 4 per day. 4 per day. I apologize. So that's okay. And a lot of them, honestly, the majority of the clients come in, they wear a mask. And they come in, I wear a mask, we wear a mask, we all wear a mask. So we're happy about that. One thing I do want to report that's not on here, I was notified by the director over in La Plata County. Their service officer is no longer with them. So she asked us if we could help her out in the interim while they're hiring. I did post it on my Facebook. La Plata County is hiring a VSO. I'm pretty sure they'll do their interviews here soon. We have helped out with some of their clients, getting their claims on track, getting them enrolled in health care. And we have a system in place where I brief Martha, as the director over there, letting her know what we've done with the clients so that she's assured that whatever actions we took, their people will also be taken care of in the interim. So with that, does the commission have any questions?
Do you know what the pay is?
Oh, the pay over there?
Yeah.
Oh, I've had a lot of people ask me if I'm going over there, so.
That's why I'm asking.
Hey, Rick,
Wait.
no, you ain't.
Wait till you see my budget request for next year. No.
You're not moving, Rick.
No, we'll be asking for a pay raise, no. No, they do pay slightly higher. He does have, or their county does have double the vets. I've always been very proud here. We have half the vets, half the population more or less of their. Yeah, we do a lot of claims, but I'm blessed. I have 2 assistants that, although it can be stressful at times, that leverages what I can do, and I'm not as stressed out.
Sure.
So, but yeah, no, I've been asked to go there. I've been asked, well, not asked to go there, apply. I've been asked to go to a state office, but I like it here.
Thank you.
So,
We like you here.
We like you.
we like, yeah, peace and quiet.
Good job in tough times. Good job in tough times.
Thank you. We'll stay in the fight, and we appreciate your leadership.
Thank you,
All right,
Rick. We
take care,
appreciate it.
everyone.
Thank you, Rick. Thank you, Rick.
Senior Services, Jonathan Parker. Jonathan, you got 15 minutes, because last time you talked for 45.
Speaking of testing, actually, my staff and I just came back from Cedar Diagnostics, and we all got, not all of us, but 6 of the 9 got tested for the antibody. So we'll see how that plays out. We should know in the next few days. It's just kind of something they requested. They
So
kind of
all
wanted.
of you got tested?
6 of us, yeah.
Oh,
I didn't want to force anyone into it, but yeah, 6 of them said yeah.
This was an antibody test.
It was, yeah. No one's symptomatic or anything like that. It just, everyone was sick through the winter time, January, February, and they brought it up, and so AAA will pay for it. So went ahead and scheduled it and did it today. So
good for you.
So not a whole lot. We smoothed out, I should say, from the first month. Obviously, and that's probably true of most agencies, most people. So the kitchen, they're still working on the plumbing part of it. Yeah. And
we got to see that when we were up looking at the solar array on,
on
the roof. We came down and saw Dave Lindhorst down.
Oh, okay.
Doing your plumbing.
The plumbing part of it, yeah.
Rework, yeah.
Well, they demoed really quick, and of course, I think we all knew that the plumbing might be a little bigger task or take a little longer, so that was the thought there. But all the equipment has come in. It's sitting in the annex. So once that plumbing is done and they get the floor done, I think it will go fast. So at least that's our hope. But it seems like it's moving. All the equipment came in. No issues. We did have one issue with a stove that came in. We had to return it. It was damaged in shipping, and when it came in, Mike Chenard just sent it back. So it didn't accept it. Yeah, and the new one has already come in and been replaced. So we're good there with the equipment. It all looks good. The frozen meal kits, we're going to hold off for a bit. We've handed out, I counted this morning, I had to go pick up a few boxes for Captain Yoakley, who does a delivery for us, a weekly delivery. And we've got about 70 boxes left, so just about 500 meals left. And so we're good to go, and we're kind of tapering that off. I don't want to say weaning people off of that, but in a sense, kind of, as we move forward with things, that this isn't something that's going to be permanent. Yeah. So we had monies for 8 pallets or 4 shipments, and initially, my goal was to get 2 shipments or 4 pallets, and that's what we've done. So if we need more down the road, the funding is there, the financing is there. We've done really well with grants and extra monies coming in because of this. So financially, we're in a really good position actually as a center. And if we need more meals, if this thing kicks back or something happens come fall time, we'll be okay. We can get more.
We got a bad situation a couple of years ago or 3 years ago with that, except for the other way around. We didn't have the money.
Oh, yeah.
We ran out of home delivered meals and stuff.
Oh.
And so, yeah, we had some gracious, generous people in our community step up and provide the money to get it done. So,
yeah, I don't want to say we're flush, but I think total it's a little over 85,000.
I think you're in good. You should be in good shape.
We're in very good shape, actually. Yeah, we're in very good shape.
And AAA has been granted some extra additional monies.
Yep.
Yeah, our
Yep.
AAA has
Yep.
been granted additional monies from federal dollars to take care of knowing the stay at home and knowing this.
Yep.
And it all came in, it's kind of virus stimulus money in a way. I mean,
Yep.
it all came about because of the COVID-19.
Yeah, of that 85, it's about 50,000 is a little over is from AAA, so that's been a blessing, absolutely. And it's discretionary.
Yeah.
So if we need to use it for something else,
You can move it around.
we can move it around. And that kind of goes in with, we're doing phone calls, we're calling folks, trying to stay in touch. And Linda Germain is also doing some light shopping for folks, just folks who don't want to get out, they're a little uncertain, a little scared. And if we need, and the talk or the thought is they'd like to see those programs more developed into an actual program. So we'll kind of see, but if we need to use the monies for that, then that's what we'll do.
And you can involve MoCo. I'm sure you already
Absolutely,
have.
yeah,
I'm sure
yeah.
that's what you will continue to
Yeah.
do. But there you have the two components. You have the staff and the transportation ability to do shopping, to do a lot of this
Do
stuff.
they,
or-
the people that you're shopping for, do they realize that they can actually pick up the phone and do their own shopping, and then you guys just pick it up? I mean.
That's actually what we're doing.
Okay.
Yeah, I should maybe clarify. It is, in most cases,
Okay.
there has
It
been
sounded
some.
like you were doing their shopping for them, but.
Oh, yeah, it is more of a pickup, and it's sort of new for, at least, I didn't even know we offered that service in town until recently.
City Mart, Walmart, I
Pick
think
up-
most
They all
of
do
them
it. They all do it. So it's been a little bit of both. And when this first came about, we talked about it because the AAA had offered some guidance or some thoughts on developing the program. So we'll slowly create structure. So going forward, it will be, we'll have some guidelines for when people call in, how we do it. There are some folks who don't know how to do the app or whatnot, but if need be, you're right, they can call in. So just as we develop it, it'll be smoother and we'll have it figured out. Okay, good. No issues with cooking meals at the Legion. It's going good. It's a good little spot. Works out really good. And it does make it easier because we're not obviously doing on-site meals. So we don't have to move the food over. Yeah, so that's going well. I did speak with Tammy Coulon of the farm over there. We kind of had a little bit in common. After I came out of the Marine Corps, I went to school in Nebraska for a couple of years. And they're from Nebraska.
Oh, yeah.
Yeah, so we did have a real pleasant conversation. I have not heard back. I'll do a follow-up call, but she was going to meet with family because it sounded like it might be maybe bigger than what they had, it'd be like a big order kind of a thing. And I told her our numbers. And so she was going to meet with family and just kind of go with that and go from there. So I'll definitely pursue it. And she did sound interested. So we'll push forward on that. And then there's really been no guidance from, sites opening up for the congregation, the on-site meals. There just has been.
I'm hoping, Jonathan, when we know if we're going to move into this next phase, and that is the partial reopening of our restaurants, which I think you kind of fall into that restaurant idea, where you can start doing some kind of the sanitation, social distancing, and hopefully maybe get back to starting to open up your dining room once you get your kitchen and everything put back together and begin that. I would hope you can.
Well, I think we can. We've thrown ideas around from the very get-go on this, from the beginning of the COVID close down, is how do we open up? Shaq and I had a good conversation about some different thoughts, different lunch times, small groups, things like that. Honestly, it is in a sense, I don't want to say a blessing, but it's worked out with the kitchen remodel.
Yeah.
This has actually been, it really has been. So it's worked, it's a win-win in some ways. So, but we'll get going, we'll get back. We do stay in touch with a lot of them, and I know they're itching to do it, and we are too, so.
And you just have to realize that's the most vulnerable population.
Yes,
You're gonna have to be you're gonna have to be very diligent about the people that are, who they're exposed to and what they're exposed to, so.
Yeah, it's definitely.
Have you reached out to CDPHE on that? As far as the for the guidance for the senior centers?
I've not reached out to them, nor have I seen any guidance from them. I tend to be inclined with Commissioner Ertel that it's a lot like a restaurant, but we could certainly reach out for extra guidance. I think there's additional restraints possibly being put on Jonathan by his funders, and I'll let Jonathan speak to that.
It really comes down to the State Unit on Aging, which is kind of issues the directives or guidance for the AAAs. The last I read, it's more of be very concerned because it's the vulnerable population. We do follow the restaurant guidelines, the cleaning, the sanitation, those sorts of things. That's something we'll have to do. But there's that extra precaution. It's a vulnerable population. So I think, all that will be taken into consideration. And then we do have other sites, that we can follow and talk to each other and kind of go from, work through of how do we open? Is someone going to open first? Who's going to be the lead? Do we all kind of say, this is what we're going to follow? And, every week we do a provider call with updates and just to see where we're at. And there hasn't been really anything moving forward as far as opening up yet because of the vulnerable population. That's all I have.
Thank you.
Good. Okay, any questions? No? Okay. Thanks, you guys. Appreciate it. No, I appreciate it. Thanks.
Let us know when you get that kitchen up and cooking up there. We're gonna come up and have a meal.
Yeah, we're gonna have a big old party. We're gonna do the liquor license thing, I think, too.
And if we're ever allowed to have salad bars again.
Oh, boy.
I'll tell you, you're gonna have more seniors up there than you're gonna know what to do.
Let's go to our senior center, our CSU Extension Office. Greg Felsen. Hi, Greg.
Hey,
good afternoon,
gentlemen. How are you?
Good, how are
Good.
you?
I hope you all had a wonderful Memorial Day weekend. Enjoyed yourself. So I'm going to give a quick update on the CSU Extension Office, and wanted to start out with a big highlight statewide, and then many people here in our region taking advantage of the Colorado Master Gardeners Grow and Give campaign. And a lot of that focuses on victory gardens, which started after or during World War II. And I know Shaq's got his garden going, and he's already starting to get produce from it. I just planted my green beans yesterday, so we'll see. Hopefully no more frost the rest of the year, and we'll get through on.
Sprinkler this morning.
Exactly. It was tough getting my watering this morning to get those going. However, I think when we talk about food security and we talk about more and more people looking to get food assistance, we need to look at also the amount of people that are calling our office looking at how they can be more sustainable themselves. And through websites like this, through education, a lot of the education from CSU Extension and this website during this period, because we've had to go virtual, is free webinars on how to do backyard chickens, how to do gardening projects so that you can grow your own food. And so being able to support that through our Montezuma County Extension Office and supporting all our local farmers and ranchers in our area as well too is a major thing that CSU Extension can support to our full community as well through the Victory Gardens. And so one thing that we're very excited to be partnering with coming up on June 6th, and I just got the email this morning, Shaq, if you're available at 11 a.m. on Thursday, we're going to do a walkthrough for the Cortez Farmers Market, which is in this parking lot right here. So obviously we've had to go through Bobby Locke in the Public Health Department, understanding the different guidelines and regulations that come down from the state level of their recommendations with Colorado farmers markets in general, and how we can provide better curbside pickup for people that just want to come pick up fresh produce and get out of there, to how we're going to have entrances and exits, having hand washing stations, having 6 feet of distance between booths, and all different types of things to make it a very safe event for food needs, so that everyone isn't going to your Walmarts or city markets, but going right to your farmers and ranchers right here in Montezuma County to support our local economy, which is a big thing. So I'm really excited of the work Jody Sutton and the other people on the Cortez Farmers Markets are doing, and I'm excited to help out as well too, starting June 6th, which will be that first Saturday. So we'll walk through that if you're available, Shaq, and that would be great. The next thing I'm going to talk about is sort of, until May 15th, the Extension Office was on a suspension of face-to-face programming. Like I said, still going on with a lot of virtual programming in a variety of different fields from our 4-H Master Gardeners and community development ends. However, the face-to-face actual programming was suspended, like a lot of people. Now we've got into May 16th. What are our guidelines and policies moving forward with that? Well, we'll have to go through sort of a events program plan to get approved. Volunteers like our Master Gardeners, our 4-H volunteers as well too, need to sign these new COVID-19 waivers, and our policies are set up based off of the governor's orders, which then come down to our local public health department as well too. So establishing those connections early so that if we do now want to do programming of 10 or less people, and it cannot be done virtually, it has to be done face-to-face, we go through this process.
Greg, so I read this, and
Yep.
there was something that really caught my eye.
Sure, yep.
I don't see it here, but it was about going into people's homes. Shaq, I don't know if you... How can we tell people they can't go in their own homes? Where did I read it at?
I'm trying to find where you're.
Yeah, I'm not
talking about.
sure.
It was...
Starting these 16.
Anyway, why don't you continue, and maybe I'll...
Sure.
I'll pick
Yeah,
it
yeah,
up.
I'd love to answer that. However, so it's happened. There's certain things within our extension programming that we need to have face-to-face. And so our first thing, which has been really great to us, and probably start out with, we want to be a great partner with our local county, but then also we do a lot of work through the county commissioners and our local county fair board. And so in this last week has been great to sit down, talk with the president of the fair board, Ellen Higgins, and also Kelly Comiskey. She just called me, so I need to call her when I get back. But Ellen and I talked this morning, we all met last weekend, of how at this stage we move forward with one of our bigger face-to-face events preparing for the county fair. And that would be our livestock tag-in of our sheep, swine, and goat. And so we needed to fill out one of these forms. Last week we met with the state 4-H program director, our Western regional agent, and our deputy director to get approval for that. And with that, we contacted also the public health department just to see what our guidelines and policies. So I'm excited to say we did get that approved, and next week, June 2nd to the 4th, we'll be tagging in our livestock animals. And so that'll be a process out at the fairgrounds. And those are the type of procedures we're going to be taking until, I'm sure you guys, everyone's waiting with chopping at the bit to hear what these new governor's orders are. And once those next governor's orders come down, luckily we've already started the wheels in motion with our fair board, with our public health department, so that we're all following those standards of what we're going to see regarding gatherings and larger events for the summertime. And so we'll be having to watch that closely as we make those next decisions of the summer events, particularly the larger county fair, of how that looks. So I know nobody has the crystal ball, and so I don't really want to, say things that, could change in the coming weeks, but we're prepared. That's kind of the message I want to put forth, is that we're prepared to whatever those orders are, knowing that we're going to make some decisions in June, talking with the fair board as well too, of the best direction moving forward, that we have the adequate amount of time to really honor these 4-H youth and youth livestock in our county, and making sure that they have a good experience through a 4-H program and through their local county fair. And so one thing with that is the tag-in. So we're excited next week to get those tags on those ears of those animals going on. And I guess the one question I needed to ask on to that is, I know we were in the process of getting a new fairgrounds manager. I just didn't know if we have approved that, or if we've or accepted the position, as that's obviously an integral person to be communicating with as well too.
So we've named Justin McGuire the interim.
You have?
Yes.
Great. And I've talked to, wonderful. On to those ends. That kind of concludes what I have for right now. If anybody has any questions, on to those ends.
I think you have that question that you have highlighted.
I have it highlighted now.
Well,
Did you find?
I think,
You understand what they're meaning now? Or
well, I'm not sure. What does it mean that I have highlighted all interactions at private site visits? Is that same with the CSU representative. Is that what that means? Must take place outside, not in some.
Oh, correct. So say we have a 4-H project leader. That's the goat leader. Not inside their house, but say you have a goat ring or you have a ring outside. You have less than 10 people. You're following the guidelines. We can approve that end.
Okay.
Or I hope we can approve that. We'd approve it on our side. It'd go the steps
Right.
onto those.
So, yeah, it just moves outside.
Yeah.
Okay. No, that's all I had.
I don't put goats in my house and chuck them out anyways. They sneak in there once in a while.
All right. Thank you, Greg.
Awesome. Thank you, gentlemen.
Thank you, Greg.
Yeah, have a good day.
James Dietrich, the Natural Resource Director of Montezuma County. Good to see you.
Hey, James.
Hello, James.
Gentlemen, I think the first thing to start with is we have the proposed e-bike rules, and we've generated comments on that for the BLM. And I believe the commissioners all had a chance to review those rules. And if those comments all look okay, then I'm just got a copy in here that we can send a signature off on. So.
Yeah, they're
We're
fine.
good.
I sent back my
I
comments.
thought we were done. Do we need a motion on that, John Baxter, to send this letter of support for the e-bikes on the BLM?
Yes, unless it's coming from them and you want to just leave that discretion to Jim. But is that letter from the commissioners?
Yes.
Yeah, it is.
Yeah, it is. Yeah.
Yeah, we can do a motion.
Okay. Then I would like, back up a little bit there, Shaq, would you,
Shaq's
buddy?
just messing with you.
Yeah, I know he is. I would
trying to
move
read the
that-
letter.
I would move the Montezuma County Board of Commissioners send a letter of support to the Bureau of Land Management, RIN 104 AE72, the proposed e-bike rules.
Second.
Motion second to approve the letter of support for e-bikes on single track in Montezuma County for the proposed e-bike rules. All those in favor?
Aye.
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 Mr.
Okay, thank you, gentlemen. Also wanted to let you know I've got a couple other notices that showed up today. So I've got one from the BLM, and this is regarding the land health evaluation report for the Flowdine Yellow Jacket allotment.
Yeah, we've seen that,
in an email, didn't you?
Yeah. So I just sent that. It's a pretty big read. It's also, a sizable document. So I sent you the link. I can figure out how to download it or get you a hard copy if you want it. But the link should be, accessible for the evening here.
You know what their assertions were in that?
Well, I tried to skim it enough to kind of get
That's what I'm interested in.
what it's looking like. Is there's a few areas where we're meeting the land health standards pretty good, and there are a couple other areas. Water is one of them, and I believe the soils were another one where we're not meeting the land health standards. However, they did say that we're making progress towards meeting the land health standards. So what this all shakes out, I don't know for sure yet. I've sent an email off to Connie to see what the next steps are and how she feels the land health report would kind of lead us.
You mean like there's not enough water, or?
It looks to me like it's water quality is what some of the issues are. And again, Larry Don, I haven't read through the entire thing yet. I was picking out a few things that we ought to pay attention to.
They hauled a lot of water, so
Yeah.
the water quality is going to be, that should be irrelevant. I mean, they're going to pull it out of a sprinkler system or something. But-
Yeah, the little bit that I read has something to do with the upstream irrigation. And I don't know if it's sediment or whether it's something it's picking up. I think we'll get some iron in it and stuff like that. So we'll have to read that full report. And it's 100 pages, so, it'll be good bedtime reading, I guess. Okay, so the other thing is Mesa Verde National Park sent us a notice, and they're asking us to comment on an EA. What they're proposing to do is do some work up on that Mesa Top Loop Road. And so when the EA hits, we'll take a look at it. It looks like to me we've got three different options here. One is the standard do nothing option. The other one is some significant rehabilitation. And the last one is, looks like including some bike lanes and things like that. So we've got a little bit of time on that, but just want to let you know that it's coming this way. Also, I've been working with CDOT on trying to figure out how we're going to proceed with the MMOF funds for the Paso Mesa Verde Trail. So I've been working also with our consultant. CDOT recommends that we should go with a brand new, just a whole brand new contract with these guys, and don't intermingle the two projects together, because the first one was funded through TAP funds, which were federal funds. The second one is coming from state funds, and so we want to try to be careful not to intermingle those two together. We could cause some problems by doing that.
With the same company then?
Yes, so I'm working right now with the same company to try to get the numbers that they think that they can do this for. I'm pretty unsatisfied with the numbers currently, but we are still in the negotiation phase on that. So we've got about 449,000 that we can work with from the MMFO. So they sent me their original estimate is coming in at 660,000. So it's kind of the standard thing that we deal with every time we get with an engineer. It's always this routine. So I think I'm going to press these guys to see if they can't sharpen up our numbers on that. I did talk to CDOT on that. They said, hey, if you guys feel like you can get a better deal, you can always bid this out. However, we are still stuck going through that RFQ process. Yeah, the qualified bidders, which is, I personally didn't find that to be a very helpful process whatsoever.
It kind of sticks you in a certain category with certain companies, like we found with the Flume. You get the historical or the company that knows all that historical stuff. They're 3 times more expensive, and yeah.
Well, it looks like a racket to me.
So
and I think that CDOT feels like it too.
CDOT's?
I'm sorry?
Is that your RFQ through just CDOT's?
That would, well, it would be an RFQ through the county. CDOT would kind of have some oversight over that. We basically, because the funding's coming through them, and we have to follow the Colorado revised statutes at this point, which is almost a mirror image of the federal statutes. So it will be a pain. Again, that RFQ process, if we were looking at a hairstylist to come in and bid on it, yeah, it would make some sense. But if it's all engineering firms, this process seems to be pretty flawed, in my opinion. However, it is something that we're going to have to probably deal with. So,
well, hopefully they'll negotiate down to the 440.
Yeah, if we can just get them to round their numbers, to make it fit, then that's probably the best option.
That is to engineer from completely from Mancos to Mesa Verde.
No, that's only on the Cortez side,
Cortez to Mesa
section
Verde.
A and B.
The other, yeah.
Yeah, the other one we're working with, Central Federal Lands on. So I will continue to get these guys to, try to give us some better numbers. If we're still coming up with something that's looking, if they can't work with us a little bit, we'll just have to bid it out.
And where's Cortez at?
Yeah, Cortez
like
is
Mancos
is they're right here.
I know, but that's what I'm saying. When we did this with Mancos, they stepped up.
That's right.
I think that should be a question asked from the board.
Well, luckily I know the mayor pro tem, so I'll be putting a little pressure on her. So we'll find out.
Bingo. Good end.
But anyway, I guess that really kind of concludes my report at this point. Yes.
And I'll tell you, I'm sorry I'm so vague on this, but I got an email from Derek Padilla here a week or 10 days ago about the Forest Service selling some land.
No, the other way around. Swicker's selling some land.
That's right, Calvin's, they're buying land, right?
They're buying that, they own that private land right by House Creek. When you go down the House Creek Road, you go off to the right, that's Swicker's land.
Yeah, and the Forest Service wants to buy that.
That's what that email is about.
Because that was to the PILT funds that we would lose.
To build the dadgum breakwater for the reservoir. If all of a sudden, I don't know how many acres, what was it, 100 and some odd acres?
107,
And they're not getting that for $500 an acre.
No, it's prime land for right next
Yeah.
to, I mean, it's right next to the head.
So, it continues to baffle me. They don't have any money to spend on their recreation at the lake, which they're responsible for the recreation at McPhee Reservoir, and yet they can come up with probably $300,000 or $500,000 to buy some land that abuts their House Creek property over there. Tell me, how do these guys keep doing that?
Maybe their priorities are land acquisition and not maintenance.
I think we know that, Shaq. I think that's I get tired of seeing this stuff. Oh, no, we can't, no, we don't have any money in our budget, our recreation budget's tiny and small. But we got 500 grand to buy some property right up here with the House Creek side.
Yeah, I'm guessing it's the land and water conservation.
I'm tired of hearing them lie to me about their financial woes. You know, when they have something that they want, something they think they want for their own selfish ends, you know, they find it. Man, they find it. It comes up somehow. It's all of a sudden, man, we've got it. Money's there. When we ask them to do something to benefit the whole area and the reservoir, that they're supposed to be the recreation managers of that whole reservoir, and they can't build the breakwater out there for the marine operator out there to keep him safe, I'm tired of them. Tired of their storytelling stuff.
No, I'm tired.
Yeah,
Tired
we're all
of
pretty tired.
COVID-19, and I'm tired of them too. I'll get some comments more.
Well, gentlemen, I think that concludes my report. I've got comments.
Sorry to unload on you, Jim. It's
Oh,
not
no,
you,
no,
man.
totally
I
understand.
know,
What
tell you.
I think we all share the frustration.
Could you, does Heather know about the conversation you and I have been having about that trail entry up there?
I don't believe so.
Would you
I would love to
enlighten
fill
her?
you in. It's a great option and idea. Also on that note, Larry Don, I will bring this to the MCRAC meeting, and we'll be having a MCRAC meeting Thursday afternoon. We're going to try for a day meeting too. So we'll try to keep those folks engaged and just see what they have to say about it too.
I forgot one other thing that goes along with that. Our no net loss policy that Montezuma County has, I want us to enforce that on this land acquisition deal. If they're going to buy 100 and some acres of Calvin Swicker's property on House Creek, I want 100 and some acres sold to a private ranch or somewhere out of the Forest Service.
Well, shoot, I
No
know
net
160 acres that are for sale. It would be great, but
Tell them that this commissioner will not approve the purchase of that land, that property going out of private ownership into the Forest Service ownership unless they sell an equal amount of acreage to some private landowner in Montezuma County.
Jim, can you relay that information and ask them to get in touch with me if they want to.
Thank you, John.
so we can relay that message. Absolutely.
All right. Thank you.
Okay, thank you, gentlemen.
Thank you, James.
Shack Powers, Administrator report.
Sorry, it had to come sooner or later. I spent the remainder of last week trying to move our variance request forward. It looks like while we've been having this meeting, the governor did open up restaurants and youth camps to some extent. He still didn't do a thing for gyms or other gathering places. So my plan is to continue to work on resubmitting a variance that would allow our gyms and other businesses to be equally as open to the restaurants. I think, knock on rock, this should be a fairly easy ask. Outside of the rec center in Toyoak, there's only 6 gyms in the county. That I'm aware of, nobody comes from out of state to use a gym. Those who are concerned about being exposed don't have to go to a gym. And people generally, if they have any kind of symptoms or any kind, generally never work out anyway. And I would say it's safe to assume that'll be even more so now. Not only that, I think the gyms should have been included essential. We keep hearing, and we heard it from healthcare workers today, if you're in the better shape you're in if you contract COVID-19, the more likely you are to survive it. So for all those who are diabetic, have hypertension, those types of things, and maybe too body conscious to run around the park or out on a trail or something, I think those gyms are absolutely essential if this is what they're claiming. We've been told repeatedly, again, that the better health you're in, the more likely your chances of surviving this is. So I'm going to keep pushing forward, and I'm going to advocate that our gyms and other gathering areas get the same treatment as everybody else. So that's how I plan to spend the remainder of my week. Somebody said, why do you keep doing this? You're just going to You're just going to get told no. You'll get told no by this group. You'll get told no by CDPHE. Why are you wasting your time on this? Well, my feelings of it are my wages are being paid by taxpayers that don't even have an income right now. And so I feel I owe it to keep playing. I owe it to them to keep playing till there's no time left on the clock. And that's exactly what I intend to do.
Thank you, Shaq.
End of report.
One of the better reports you gave, Shaq.
Thank you.
Very well thought out. This commissioner's been to Zoom meetings. I've been, had a workforce Zoom meeting this past week, and unemployment numbers in the state of Colorado are absolutely staggering and unprecedented numbers. And the unemployment compensation fund is going to be depleted. I think it may already be depleted.
Didn't they anticipate they might make it till June 15th?
I think that was probably optimistic, but I don't know.
Not very far away.
It's headed towards the end. There's that many people employed. So.
And what that means for small business owners is their unemployment insurance is going to go up, what I read, 86%.
It's going to go right through the roof, and they're going to pay exorbitant amounts for unemployment insurance. Yeah. And not an end in sight. You know, the bad thing about this, there's not an end in sight yet. They've made it through the incentives on the unemployment, the $600 additional that everybody got when they filed for unemployment, got an additional $600 from the Fed. There are a lot of those people aren't wanting to come back to work. I've talked to 2 businesses that can't get their employees to want to come back to work because they're making more money at home with the care incentives for the COVID incentives from the federal government, so they don't want to come back. That's going to end. You know, there's going to come an end to that, and then they're going to be looking for a job, and the job may not be. I think it's just. I think they've set a lot of things up for failure with that stuff. It's just.
And when do you foresee the feds running out of money to pay that?
I think they're out of money, but I think they can keep printing it. I think, Shaq, they can still keep printing it. You know, when you're, at $30 trillion in debt, and you can't even service the interest on the debt that you have, I'd say you're more than broke. You're more than broke. But if you have the keys of the kingdom and you can print the money, then you can keep printing the money.
Anything else?
So, I guess one of the questions that I have is how do we help Shaq? Because without a support letter from the tribe, you know, any kind of a variance will go.
I'll keep asking. I've been in communication with Peter Ortego, and I'll keep asking. I'm going to play until there's no time on the
So
clock.
actually, we probably haven't brought that up yet with the GMs, right? Because we just found out just minutes ago.
County.
I emailed Peter Ortego this morning.
Oh, do you know if he's responded?
I don't.
Ask him if they're going to open up the restaurant at the casino.
That's an interesting question. I'll ask him that.
Well, the reason I want to know that is because they're adamant about our businesses not being open. So our restaurants, they said it was unsafe. So if they open up their restaurant, be kind of hypocritical, I would think. But I guess we'll find out. Go ahead, Commissioner Candelaria.
Well, on Wednesday, the 20th last week, we actually had a Zoom meeting with Jill Ryan herself and some of her other staff. We had a slideshow that we went through. 151 participants were on that Zoom meeting. Talked about 2 basically different categories. One was the medical side and one was the distribution side to the $275 million for the local governments. And I had asked this question to Shaq, you know, what was our allocation and what did we receive?
And so I've checked with Ellen Black, and we've not received anything yet.
So after I talked to Senator Quorum and then Congressman Tipton on Friday, you know, the allocation was $170 per person. And because of the way the feds send it to the states and now the states can distribute it however they want, it sounds like we're going to be in rural areas held back to 109 distribution per person instead of the 170, which is the question that I'm asking them to ask our governor. How can they do that? How can they separate and that our people are not as critical down here as they are in the Front Range? So hopefully with them going back into session today, it'll probably be a pretty heated discussion up there. Let's see. Because the governor did state, he did come in on that call, and he did state that that was all sent. So my question is, have we gotten it? Because as of right now, we have not received it. So I'm going to stay on top of that to see what we actually get. Did have a call with Karen McGowan the next day on the 21st, basically talking about the letter of support from the tribe and how that came about. And that came about because of a special group that works for the governor. And that's all I got from her on that. Had a 521 Zoom meeting with the MBT, which is the Montezuma Business Task Force. They did allocate, like I said, the thermometers earlier, and I believe they had 35 left, and they gave 5 to Mancos, 5 to Dolores, 15 to Cortez. The tribe said they didn't need any, so those are out there for the businesses to get if they need them, specifically for the restaurants if they're needing to do a thermometer check. I also talked to Bridget. She can get more thermometers. Copied Spratlin on this so that he knows that if they need more, we can actually get more through the hospital, which are at a way reduced rate. So thank you, Bridget, for that. Also talked about the PPP loans. Mary Shepard from Durango, who does the, what is the acronym of that? SBDC?
Small business.
Small
something.
business. Anyway, loans. So people, there's still some money out there for that, and the EIDL loans, the emergency injury disaster loans. And then on 5/21 in the afternoon, I was with Commissioner Sukla on the phone call to the tribe. And I think everybody is aware of that. They denied us our letter of support, and I will leave it with that by a 4-3 vote. And that's all I have.
I'd like to comment on that call with CDPHE, that Zoom meeting on, I think it was Wednesday, when they were supposed to be discussing variances, and they spent about the first hour going over the disease process, and then about 15 minutes making excuses about why they haven't been approving variances. One thing that Ms. Ryan said that kind of caught me off guard was that they weren't expecting that many local entities to apply for variances, which to me shows just how out of touch CDPHE is with the people in this state. And we heard it again from our nursing home director today and from the hospital. It just shows that they are completely out of touch with the people that they're regulating.
Well put.
Yeah. Wow. I guess I would have to concur with Shaq as far as the gyms. I think that I look at it this way. You got a bunch of people that are out of shape that tell you to stay home. They don't exercise. They're obese by their own admission, unless they have the gland deal. Telling a bunch of people that eat right, work out, and to try to be healthy. Those people are the ones telling them how to be healthy. It is absolutely ridiculous. It is upside down. It should be the other way around, telling it. And I'm glad, I guess, that the President Trump said that our churches are back in business. So that's a good thing. And
Trump the governor, I like that.
I don't have anything else.
John?
Except for I'm sick and tired of this COVID. And we do not have a pandemic. Commissioner Ertel has said it. We've got 17, no, what'd they say? 17?
People that are actively ill.
17 people that are actively
None of them are in the
ill.
hospital. None of them are in the hospital.
None of them are in the hospital, and all these people come and try to tell us about how big of a health mercy. But my prediction is this, and I'm telling you, those Navajos are going to be our saviors. Those Navajos are all going to get it, and come this fall, when the rest of us get it, because they wanted us to try to protect ourselves, we're going to be asking them, can you bail us out? Because we're all going to be sick. We'll see.
Ooh, that'd be turnabout, wouldn't it?
It would be a turnabout, and I hope they treat us the way that they've been treated.
You also have John. You left him off.
The county
John.
attorney.
Oh, I apologize. John Baxter, sorry. We usually don't like you to hear what we say, so
You're okay.
go ahead.
I don't have a lot to report. We've got the week after next, our Walmart case is set for a hearing in front of the Supreme Court, which is in Denver, has a panel on consolidated multi-district litigation. And so essentially Walmart's trying to consolidate all of the county cases, and there's more than 30 of the counties that are involved in this lawsuit, into Arapahoe County. They want them all to be in Arapahoe County. We haven't been instructed on how we're going to appear for that hearing. I am presuming that they're not going to want me to have to show up in Denver at the Supreme Court, since for the most part we're doing everything by WebEx, which is similar to Zoom. I have that the week after next, and so hopefully I will not be in Denver, and I will be just on my computer at the Supreme Court. We also have, one thing I want to just reiterate is a thank you to our law enforcement, district attorney's office, sheriff, the jail. There have been lawsuits filed against jails in Colorado. They're not going well for the counties, and it's because COVID's gone really exploded in some of the jails. So I'm extremely thankful and appreciative to our local, basically, court system and law enforcement. We're lucky that it hasn't hit us hard. There is, and I'll bring this up again later after I've had more time to review it. If you guys recall, with the CDPHE, bring them back up, but this has to do with the landfill. When we closed the old part of the landfill, CDPHE is now requiring us, and it makes a little bit of sense, to put something on the deed of our property that says, hey, this used to be a landfill, heads up, be careful. And so I shot an email to Mel Jarman today at the landfill, just to get his comments on the deed restriction they want on there. And I'll probably soon present that to the commissioners to sign off on. It's basically, we don't have any, I think, intent on selling it, but the idea is if this property gets sold in 100 years, they need to know that there was a landfill there. That's it. So I think that's it as far as what I have to report.
Right. Thank you, Mr. Baxter. Anything additional, Commissioner?
Actually, I do have one other thing. Got an email from Julie Constant, the PE at CDOT, and she's working with the Lewis Areola School, which is another step that I've been working on her on for County Road N and P, to see if we can't get those turning lanes to the west. But she's working on another zone at the Lewis Areola School on 491. It's just asking if we would support that. So before I respond to her, I definitely would at that school zone right there off of 491. It's just part of that corridor that we've been talking about to give
that have those
that
65
truck
mile an
traffic.
hour traffic and intersections coming in and turn lanes are needed, yeah.
Right.
And they've done such a great job with the shoulders they've got there. They've been able to expand and make turn lanes and not have to go out and rebuild pavement and rebuild their road and stuff. With repaint, restriping, some of those is working out very well. The Rock Springs Church is a perfect example.
And the intersection
34,
just
Road 34 out the way there, yeah, they can do that.
If you guys don't have any issues with that, I'll go ahead and respond to her on that. So that'll be forthcoming for the Lewis Areola School. Okay.
Public comment. Hi, Heather. Come on up.
Hi, Heather.
This actually relates to lodger's tax. I know you guys voted. Oh.
State your name.
Heather Alvarez with the town of Mancos. I wanted to thank you guys again for working with us on the lodger's tax. I couldn't exactly see what they had allocated, so.
29,000.
Okay, so.
For Mancos.
I would actually like to ask, on behalf of our chamber, we met August of 2019, kind of talked about lodger's tax. Mancos pays over 57% of the lodger's tax for the county. And we had talked about how can we partner with you guys on that. So in January, Mancos gave the chamber $6,500 to cover their operating costs. We also share an event calendar with them. They've done an amazing job, not just during the recent activities that we've been seeing, but Maggie rocks it out of the park working with our local businesses. I would ask, I believe they asked for $35,000. I don't know if you guys can go back. If you can't, it's okay. Something to think of for next year, though. If we could meet their request and make us, I believe it's justified. I think it's an investment in the future. I'm all about keeping money in reserves, holding some back just in case. However, we have also hired an economic development coordinator that is working. We've budgeted $30,000 for that will be working very closely with my chamber. For the next 6 or 8, 9 months, she'll be working on economic recovery. But she will then start be working on economic development to bring additional business. So if you guys could see your way clear to award Mancos what they asked for, I think it's money very well spent on the other side of Mesa Verde. So thank you very much.
Thank you, Heather.
Thank you, Heather.
Danny Wilkin, 11728 Highway 491. Just a couple of things. Kind of right before COVID and everything came up, there was a lot of discussion going on about starting to have cleanup down around the M&M. Did that pretty well just take and stop? Are they looking at still moving forward with that? Because I think, wasn't they going to start moving dirt or something in June or a little bit later, Jim?
It hasn't stopped. It's slowed down because the priority isn't up here the way it was, but we're still working with a group that is trying to form a 501(c) organization so that they can, if that does in June become tax delinquent again, it would be the 3rd year. So that they are in the process of setting something up for that. But as far as CDPHE, again, working on that cleanup, that is still supposed to be taking place at that period of time. And we'll see after, well, they extended the date. Now it's not June 15th. I think it's now July 15th before they go into being delinquent again. So it's still being worked on. It's just as they pushed all of the dates back for the delinquencies, we can't move until that happens.
Okay. And then another question is, we continue to take and look at the shortfalls in money coming into the county and everything else. I was just curious what kind of discussions were going on amongst you guys and Shaq and stuff as to far as amounts that you might have to cut out this year or different things that you might have to cut. Just looking at the next year's probably really when all the economic impacts of this really start coming through. I was just wondering if there was any discussions on that right now and stuff. So
I think, Danny, we're comfortable with this year's budget. I think the budget that we did for 2020 is solid, and our revenues are there for that. Where we're going to really sit down and start taking a serious look is when we start budgeting for 2021 and see what our revenue projections are, what we're looking at for revenue, and see how that budget's going to be affected by shortfall in energy. Kinder Morgan's down. I mean, there are going to be some real revenue streams that are going to be a lot smaller than what they've been. Property tax probably being another one.
Yeah.
And if Gallagher goes the way they think it may, and it may drop a couple of more percentage points. So.
Because
and we have made some cuts already. Some that we viewed a couple of months ago.
Yeah,
some we did. We did.
So
a percentage of the travel and training across the board.
We cut some of the dues, travel and training money. Obviously, nobody's traveling right now. We have also deducted money for everything that we've spent out of COVID-19. We've deducted that from money we had set aside to begin digitizing the county's documents. What is going to be assessed for commercial production and that sort of thing is due to our assessor on the 12th, and I have an appointment with her. I'll be spending the morning with her on the 15th, so starting to get an understanding of what those numbers are going to look like in 21 and 22.
Okay, all right, thank you.
But it's going to be a lot.
Yeah.
And lastly, what they're talking about in the state right now is the repealing of Gallagher.
Right.
And how is that going to affect us if the RAR moves from the 7.15 to the 5.88? So there's a lot happening, obviously starting just this week. and then how we're gonna have to move within those, for those, budgetary items.
Okay.
So
But if
we are working on it.
If we dropped the 2 points, like Commissioner said, we lost, it was 1.3 million shortfall, so that would add, I would say we might be looking, if you added energy, 6-7 million less than our budget this year.
Right.
But that's just a guess. We don't have a clue.
It depends on what they do.
Yeah. Okay, all right, thank you
We'll know
guys.
right before the budget, we
Yeah.
approve the budget, and then we can do that accordingly.
Yeah.
Yeah, we'll know.
But
And by that point, it'll be too late. Whoever wins in June's already stuck, huh?
That's why I'm asking.
That is correct. I mean, it could be a big shortfall.
Right.
And we're gonna have to make some tough decisions based on the shortfall of, what stays and what goes. It's, but we're not gonna be unique in any situation. Everybody's gonna be making cuts that
The
are,
state of Colorado's gonna be making some horrendous cuts in their budget. I mean,
Right.
everybody is. Yeah.
which was why it's critical for me that we get that 170 per person instead of that 109 that they're trying to use to balance the state's budget,
Right.
instead of giving it back to the local governments,
Right.
that, as it was promised in the CARES Act.
Yeah. Well, and that's why I was just asking is, it's, and I'm sure you guys are, but it's better to be ahead of the 8 ball instead of behind it, and stuff, and so I was just curious.
If you know where the 8 ball's
That's right,
at.
that's exactly, oh, I
You
agree,
better know
I
where the
agree.
8 ball's at.
Yeah, so,
Yeah.
all right, well, thank you much.
Yep.
Well, the public comment coming in from YouTube is is in front of you. Do you each want to take a turn addressing one? And I would like to say again, I've seen racial slurs coming up on this today, and this is not the place for anybody's bigotry. We are neighbors here. If you want to direct your anger at someone, direct it to the state whose politics and politicians are being the root of the divisiveness. Don't be taking that out on your neighbors.
Jack.
So the first one is from Robert I'm gonna butcher the last name.
Cardokas.
Okay. And he says, for public comment, would Commissioners Ertel and Sukla take the opportunity to publicly apologize for their recent racially insensitive remarks to the Navajo Nation, Ute Mountain Utes, and Chairman Hart?
I think you can just read them all, Shaq. This is public comment. This
Sure.
is where they get to comment and we get to listen.
Yep.
We do not have to take any actions or comment on anything, so.
Be nice if
think
you
you can
spelled
go to the
Chairman
next
Hart's
one.
name correctly.
MB McAfee says, is this when you will read the letter? ? Thanks. And so I have forwarded that letter on to the commissioners. They asked that it be included in the correspondence, and I did reply to your email giving you the opportunity to come down here and read it out loud. SS Whitehorse, I second.
Don't read anything from that, from
Okay.
him.
Okay, and
He's a racist.
Kelly H., with the opening of restaurants, what does that mean for things such as community centers and stuff like that for personal leisure? And
That
I
would
may
be-
have to seek clarification from CDPHE on that
That might be a good idea.
before I insert my shoe into my mouth. However, my thought would be, if one thing can be open to 50%, my initial thought is that should be applicable across the board, but I will seek clarification from CDPHE.
It should be across the board for everything, except for nursing homes. They've already got a plan there. Commissioners, anything else?
I have nothing.
I have nothing else.
Looking for a motion.
I would move.
Second.
Motion is second to adjourn. All those in favor?
Aye.
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 Shaq, James, I laid that up there and he didn't grab that. That's the letter for the e-bike. I just dropped that off to his office and
Or I can. I got to get a copy for Miss Purcell also.